morning, Santosh sir. I think we were just waiting for you. Once you are here, then we can formally start the program now. So Santosh sir, if you are listening, kindly allow me to start the program.
Please go ahead. Please go ahead. I'm there.
Okay, on to all the dignitaries present here, to all the participants, and all our expert speakers, on behalf of National Institute of Disaster Management, Ministry of Home Affairs, Government of India, I extend a very warm 2 hours discussion on a very important topic today. As all of you are aware that India is surging almost with 60,000, 70,000 and 80,000 cases every day. And our health facilities are actually overwhelmed managing the COVID-19 patients. So it has been of prime importance that how can we take care of COVID-19, mild cases of COVID-19 within the four walls of our home or within the comfort of our home environment. And also along with that, it's equally important that prevention is the most important thing. So when we are talking about prevention, uh, uh, we already talked a lot about preventive measures, wearing mask, sanitization, hand washing, and everything. But today we are going a step ahead out of it because as a manager, uh, 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 I'll not say expert, but as a disaster manager, it's our responsibility that we should provide all the expert guidance, advice, and help to all our listeners, all our participants. And in that situation, in that scenario, like I told you, this is one step ahead now. Today we will be talking a lot about home management of mild cases of COVID-19 along with preventive measures. And we have a lot of distinguished panelists here. And today, this is let me tell you that this is a two-part webinar talk. First, today we'll be talking about prevention and home management today, and we will be expecting a lot of questions from you because we understand that there are a lot of anxiety, misconception, and I'm receiving a lot of background noise. Can anyone can see from where it's coming actually? Host, can you mute everyone else right now? Okay, now whenever I'm starting speaking, then the noise is coming in the background. Anyways, yeah, there are a lot.
मत हटा या तो हटा दे.
That's better now. Thank you. So I was telling that this is a two series webinar. I don't know why there's so much disturbance here. Today about preventive. That all the participants, all the
I can't hear your voice, Dr. Raka. I know.
Please pass on hosting to me. रंजन जी होस्टिंग मुझे ट्रांसफर कर दो थैंक यू वेरी Okay, now you can hear me quite clearly. I think that there was some technical problem. I'm sorry for that. Now it's corrected. So I was telling that this is a two-series webinar, and the first one where we are talking about prevention. And the second is, since we will be having a lot of questions after that, so we will be taking a lot of all the questions will be taken by our experts who are experts in the series of webinar, the Apollo Hospital, the Medanta-Medicity, and the third one, Fortis, and along with our distinguished speaker from New Zealand, she is also with us. They all will be taking, and also NDRF Commandant NDRF Doctor will be there. They all will be taking all of your questions and all of your queries. In fact, a lot of noise I'm getting. I don't know why. One of my friend is helping me to let me know that how can I do that. Thank you, Lila. Thanks a lot. Uh, going ahead, the first, I'll not take a lot of time of yours. I'll request Professor Santosh Kumar, after being this deliberation done, sir, come up with your keynote address about this webinar, and after that, we'll go with the first speaker. So, Santosh Kumar, sir.
Yeah, good morning. Good afternoon. Dr.
Hello.
Medanta and all the distinguished panelists who are present here, and the participants who have joined, particularly on home management of COVID-19. So, hearty welcome to you from the National Disaster Management and the Child Disaster Risk Reduction. It's a very important time. So we say that only most of the year months have passed already, but still we are dealing with the problem of COVID-19. So this is still time mentioned from the CDRR and thanks to my team, Dr. Raka and Dr. Balu, all have taken it bring and managing as a kind of a COVID-19 as the biggest challenge. I would just flag 3-4 points from as part of the NIDM's concern why we are together spending 2 hours on the COVID management. One is that the distinguished panelists they can address in their time of panelists. One is this when we smile COVID-19. So what is this mild COVID? How to quantify this mild? When we can understand this is mild and this is now moderate and this is a high. So that for the common person understanding so that they can take decisions. And they can take decisions that whether the home quarantine is better or to consult a doctor or to go to the hospital. So this is one thing which we wish to find out from the expert panelists. Any individual can decision. The second is this, many of the countries have given as a kind of a precautionary measure not to stress hospital and healthcare too much. And they're giving advisory that unless and until you have the breathing problem, don't cause trouble to the doctors or in the hospitals. So that is also important when to call doctor and when to rush. Many cases which we are seeing in India that they found that they are just having the fever and they are rushing to the hospital. They are coming back to the home safely in terms of but they report to the hospitals problem. Majority of them are not coming back. So we say that the problem has accumulated, and so now it's very difficult to provide whether it remedies are, or whatever the kind of still the unknown problem, and going for the known solutions. So this is another challenge. The third thing which I would like to flag in terms of this India way of management, many of that Indian way of management, and stressing upon lot of videos are coming on the WhatsApp messages that home remedy is possible and that go for kadha, which might not be known to the Western world, that what is kadha and what we are taking. But the kadha is prescribed. Many doctors are advised finding problem of breathing. You can change your sleeping posture, and instead of doing X and do the Y, kind of. So that is another thing which is coming, which will help you in breathing. Fourth thing which will we need the home remedies advice, that how this vitamin C tablet, but everybody is buying a vitamin C, and they are having this with the Ginkgo white in that, and saying that you go for the treatment and take every day without any medical prescription. So and for immunity and all. So people are getting confused every day. Sometimes World WHO is giving X direction, tomorrow Y direction is coming. Because of the virus is unknown, character is very unknown. People are still grappling with the vaccine and all. So they wish to understand whether children should be allowed to go to the outside to the home. Now unlock is there. So whether they are safe outside or not in this environment, whether many of the parents I was discussing with them, and they think that children are immune because their immunity is much higher than the older. What are the myths to be broken? What are those myths which can be broken? And say similarly, the old aged people get affected much more. Sometimes the newspaper article also said that the number of morbidity which were analyzed, and we found that it is women are least affected than the men. So what is this myth about this women's immunity and the men's immunity? Biologically, means in terms of the medical terms. So few of these questions which we can think of, and especially I would urge to focus on that how mild is the mild. That is to understand very important. So I will not say much because the panelists are big, and they all have the knowledge, and many people have joined to understand that what are the home remedies and avoid hospital care. And because hospital is also too much stress, even if they are going, they are not getting the kind of treatment they want because doctors themselves are getting affected. So the fear factor amongst with the doctors, the health service also, and the fear factor also amongst the victim of the coronavirus. So both fears, and the household treatment is also that many people get traumatized and they are getting up, and the deaths are occurring due to this trauma. Many people are committing suicide. So that is also cases coming. So how to have a striking the balance in managing the mildness and also this. So this much from my side as a from NIDM. Few questions for the commoners, which I thought I should be requesting all the distinguished panelists to address upon. Once again, I welcome to all of you, and I'm sure that we have a guest from New Zealand. So Dr. Sandhya, I'm sure that your experience of the Western world probably would help, although it comes in the Asian country. But I would say that it's a developed country, and then you can see that how the medical management at home is going on, and how you have been, I think you are familiar with Indian thing also, which I refer to Kadha and all. So how the dilemma between the two could be. Thank you so much once again. And I welcome, and I request all the panelists to please move on. Dr. Raka, I'm handing it over to you. Once again, on behalf of the NIDM and Ministry of Home Affairs, CCDRR, I welcome all of you. Thank you.
Thank you very much, sir. Thanks a lot. That's a wonderful welcoming and keynote address both combined. And along with that, let me introduce, before the first presentation, let me introduce Dr. Sandhya Ramanathan, who has very kindly agreed to give us her time. And she has been a pioneer, in fact, in practicing these home remedies. And before just reading out her bio, let me tell her she has been really a pioneer, and her videos on WhatsApp or YouTube and everywhere on social media, Instagram and everywhere, that has been translated into many foreign languages as well as in many Indian languages. So, madam, let me tell all the participants about you, a little bit about you. Dr. Sandhya is a general practitioner in Auckland, New Zealand, and she has completed her medical degree from the University of NSW, Sydney, Australia, graduating with honors in 1999. After that, she did her postgraduate training on Sydney at Westmead Hospital and completed a diploma in child health at the Children's Hospital, Westland, in 2001. In 2004, Dr. Sandhya gained her fellowship of the Royal Australian College of General Practitioners. A little bit about family background of Dr. Sandhya. Dr. Sandhya was born in Hyderabad, but her roots lies in Delhi and UP. And soon after her birth, her family migrated to Sydney, Australia. Her parents are from Delhi and UP. Like I told you, her father, Mr. Vikas Singhal, a graduate of IIT Kharagpur, helped establish the first Hindu temple in Australia in way back 1977. Dr. Sandhya has a strong pride in her Indian heritage and has always maintained close ties with her extended family and friends within the India. Since the beginning of this COVID-19 pandemic, Dr. Sandhya has been active on social media, raising public awareness regarding the precautions that needs to be taken to avoid COVID-19. She began recording on YouTube videos providing practical tips to help people safely navigate the pandemic. Dr. Sandhya believes the only way to navigate the COVID-19 pandemic is by raising awareness and educating the public so they can understand the precautions, and they need to take a preventive, they need to prevent getting or spreading COVID-19 further. So Dr. Sandhya, you are already a rock star, we all know, but now here you have a lot of responsibilities on your shoulders today. So now you are a presenter, Dr. Sandhya, come forward and go ahead with preventive and all the talks. We will be listening you.
Okay, sure. So I'll just take over the screen. Well, thank you very much, Dr. Raka ji, for that wonderful introduction. And namaste to everybody, and kia ora from New Zealand. Today, हम बात करेंगे prevention और home management, mild COVID-19 की. और इस presentation के through मैं आप सबको समझाने की कोशिश करूंगी शुरू से कि कोविड क्या है, उसकी बायोलॉजी क्या है, हमें उसे अवॉइड कैसे करना चाहिए, और अगर हमको कोविड हो भी गया तो कैसे हम उस इन्फेक्शन से लड़ सकते हैं, और कैसे हम उस इन्फेक्शन के जो साइड इफेक्ट्स हो सकते हैं उनको कम कर सकते हैं, या यानी कि उसकी रिस्क हम मिटिगेट कर सकते हैं. तो एक्चुअली इट्स क्वाइट इंटरेस्टिंग जो डॉक्टर राका जी ने मुझे अप्रोच किया था, and when he said that he is from the National Institute of Disaster Management of India, I thought it was very appropriate because ये जो video on home management of mild COVID जो मैंने बनाया था वो मेरा खुद का अपना disaster management plan था, क्योंकि अगर देखा जाए तो COVID-19 एक disaster है, जैसे दूसरे disasters होते हैं, earthquakes या tsunami, ये आप कह सकते हैं कि एक unnatural disaster है. लेकिन जो भी disaster अगर हमें face करना है तो उसके लिए हमें prepared रहना चाहिए. हमें अपने like अगर if you live in a city for example जहाँ पर ज़्यादा earthquakes होते हैं तो आपके घर में वो सब सामान होंगे जिससे आप अपने family और अपने आप को सुरक्षित रख सकेंगे. तो इसी तरह मैंने ये plan बनाया है ताकि जो worst case scenario है जो मैंने address किया था अपनी वीडियो में कि अगर वो health system भी overwhelmed है और आपको कोई test you can't get a test या आप hospital भी नहीं जा सकते, वो क्या चीजें हैं, वो क्या इक्विपमेंट्स हैं जो आप घर में रख सकते हैं, और कौन से स्टेप्स आप फॉलो कर सकते हैं जिससे आपको सबसे अच्छा आउटकम मिल सकता है basically. And this was the basis of all the reading and research I have been doing since the beginning of the pandemic, is that rather than focusing on the problems, I was trying to focus on finding the solutions and figuring out कि कैसे हम जी सकते हैं, कैसे हम इस pandemic को safely navigate कर सकते हैं. तो without much further ado, I'll start my presentation, and hopefully आप सब लोग कुछ ना कुछ सीखेंगे इस presentation के जरिए. So actually, my theory, I have a vision for COVID-19 pandemic, and that is that we need to replace ignorance and fear with knowledge and determination. यानी कि जो अज्ञानता और जो डर है लोगों में, उसको हमें ज्ञान और विश्वास से रिप्लेस करना है, और हमें सावधानी से और समझदारी से फिर हमें आगे बढ़ना है, लेकिन आगे बढ़ता रहना है. We have to basically keep on living, but we have to live within the parameters of the new rules that are necessary. So that is, the reasoning behind all the education that I'm going to try and provide today. So सबसे पहले, I would just like everybody to understand basic science of ये COVID-19, कि ये असल में ये चीज क्या है. लोग डरते हैं क्योंकि ये लोग सोचते हैं कि अरे this is an invisible enemy, हमें दिखाई नहीं देता है, कभी भी किसी वक्त हमें अटैक कर सकता है. ये ऐसी बात नहीं है. आपको ठीक से समझना चाहिए कि क्या है ये वायरस, और किस तरह से हमारे बॉडी में एंटर करता है, और कैसे हमारे बॉडी में अटैक करता है. तो in order to explain this, मैंने एक specifically इस talk के लिए मैंने एक animation बनाया है with the help of some friends. And one of the strengths of New Zealand की जो COVID response हुआ है, it's that यहाँ की जो scientific communication है, it's very very good, for everybody, for जो आम आदमी, जो common लोगों के लिए काफी अच्छी तरह से गवर्नमेंट ने हर एक मीडिया चैनल पे हमें सब समझाए कि ये जो डिफिकल्ट कॉन्सेप्ट्स हैं उनको बहुत सिंप्लीफाई करके समझाए. तो टुडे I would like to share with you some of these concepts. One of them is this cartoon strip, which I have made into an animation with a Hindi voiceover to explain to you what is COVID, and what are the steps, the precautions we need to take to avoid it, and how we can basically control this pandemic even without a vaccine. तो और वो जो तीन वही है मेरी जो ये पूरा टॉक का टेक होम मैसेज, ये इसी एनिमेशन की थ्रू है. और I will be launching this video on my social media platforms and also sharing it with NIDM. And I would encourage all of you to share it with as many people as you can, and your children, so everyone can understand. So please watch carefully, and I will bring up a few points about it straight after.
Actually, it's not good sun.
Can you hear?
I can't see video.
You can't hear anything?
We cannot see any video. Well, although voice we are listening, but it's not.
Their video is not visible. So
Why is the video not visible?
yeah. Video is not visible.
Share your screen, I think.
Share your screen. First.
What's the sheet? Have you not seen my screen?
No, not at all. Yes, now your screen is visible. Go to the full screen mode.
Okay.
Now you play it.
Can you see now?
Yeah.
Yes, see now.
We can see, but voice is still not very clear, Dr. Sandhya.
The voice is not clear?
We can see the video, but voice is still like previous day. Initially, we did a trial run on that.
Is that better?
No voice at all. Perfect. It was going perfect now.
That was fine?
And that was going perfect right now when you stop it.
कोविड-19 के साइंस के बारे में 3 आसान चीजें हैं जो हम सबको समझनी चाहिए। शुरू करते हैं बाय जूमिंग ऑल द वे इन। वायरल पार्टिकल्स बहुत ही छोटे होते हैं, किसी बैक्टीरिया से 1000 गुना छोटे, और ये बहुत सारे होते हैं। अमूमन एक सी वाटर ड्रॉपलेट में 10 मिलियन वायरसेस पाए जाते हैं, लेकिन खुशकिस्मती से इनमें से ज्यादातर हार्मलेस होते हैं। वायरसेस में प्रोटीन शेल होता है और उनके अंदर जेनेटिक मटेरियल, जिससे उनकी संख्या दुगनी होती है। कोविड-19 एक आरएनए वायरस है और इनके आसपास फैटी एनवेलोप है। इसीलिए साबुन और पानी से हाथ धोने से ये फैटी एनवेलोप डिस्ट्रॉय हो जाते हैं। नेक्स्ट, वायरस को रिप्रोडक्शन के लिए एक होस्ट की जरूरत पड़ती है, अ सेल। एक बार सही सेल के कांटेक्ट में आ जाने से वायरस उसे हाईजैक कर लेता है और फिर वो सेल्स की नकल कर उसकी कॉपीज बना लेता है। इस प्रोसेस में वो ओरिजिनल सेल को भी डिस्ट्रॉय कर सकता है और ये नई कॉपीज इसी प्रोसेस को बार बार दोहराती है। अब थोड़ा जूम आउट करते हैं और इंडिविजुअल ह्यूमन स्केल के संदर्भ में इसे समझते हैं। फर्ज कीजिए मुझे कोविड-19 वायरस है। जब मैं खांसता हूँ, छींकता हूँ या बात करता हूँ तो मैं वायरस कॉपीज को फैला रहा हूँ किसी नए होस्ट की तलाश में। ड्रॉपलेट्स नीचे सतह पर गिरती हैं और मेरे आसपास हवा में। अगर मैं ऐसे अपने हाथ में खांसता हूँ या अपना नाक साफ करता हूँ तो जब तक मैं अपने हाथ नहीं धो लेता, ये वायरस मेरे हाथ में रहकर और चीजों में फैलता है। कोविड-19 कुछ सर्फेसेस पर 3 दिन तक जीवित रह सकता है और ये आपको सिम्टम्स दिखे उससे भी 3 दिन पहले औरों में फैलना शुरू कर सकता है। कई बार तो ये कोई भी सिम्टम दिखाए बिना भी फैल सकता है। मतलब मैं आम जिंदगी जीते हुए अनजाने में भी इसे स्प्रेड कर सकता हूँ और इसीलिए हमें हमारी कोहनी में खांसना चाहिए। अपनी और औरों की सुरक्षा के लिए मास्क पहनना भी एक फायदेमंद तरीका है। हाँ, हो सकता है आप इन्फेक्टेड नहीं हैं, लेकिन आप इन ड्रॉपलेट्स को पिक कर सकते हैं अगर आपने किसी दूषित सतह को छुआ हो। अब ये वायरस आपके हाथ में है, पर क्या इसका मतलब ये है आप इन्फेक्टेड है? वेल, अब तक तो नहीं। इस वायरस को आपके शरीर के अंदर जाना पड़ेगा और ये सिर्फ तब मुमकिन है जब आपका हाथ आपकी आंखें, नाक या मुंह को छुएगा और इसीलिए हमें फेस को नहीं छूना है जब तक हमारे हाथ साफ ना हो। लेकिन फिर से थोड़ा और जूम आउट करते हैं, क्योंकि यहाँ सबसे बड़ी समस्या व्यक्तिगत नहीं है। ये सिर्फ मेरे या आपके बारे में नहीं है, ये हम सभी के बारे में है। ये वायरस एक बड़ा अनुस्मारक है कि इसमें हम सब साथ हैं। थोड़ा और जूम आउट करते हैं। वायरस की स्प्रेड होने की पैटर्न उसके माइक्रोस्केल वायरस रेप्लिकेशन से सिमिलर है। हम सेल्स की तरह हैं, जो बस इन्फेक्शन के इंतजार में है, लेकिन हम हमारा बिहेवियर बदल सकते हैं, व्यक्तिगत और सामूहिक। हम ये डॉट है या ये वाला या ये, क्योंकि हमारी इंडिविजुअल एक्शंस बड़ा बदलाव ला सकती है, सिर्फ हमारे लिए नहीं, हजारों लाखों लोगों के लिए। दवाई के बगैर भी हम इस महामारी को रोक सकते हैं। हमें हाथ धोने पर, देह से दूरी और मास्क पहनने को सीरियसली फॉलो करना होगा। हम साथ मिलकर काम करेंगे तो ज्यादा शक्तिशाली होंगे।
So, I would like to highlight इस वीडियो से मैं 3 पॉइंट हाईलाइट करना चाहूंगी। एक कि जो वायरस पार्टिकल्स हैं वो काफी छोटे होते हैं। जैसे मैंने कहा था कि एक सी वाटर ड्रॉपलेट में 10 मिलियन वायरस पार्टिकल्स हो सकते हैं। सो बट जो वायरस पार्टिकल्स हैं वो अपने आप हार्मफुल नहीं है। वो तभी हार्मफुल है जब वो हमारे बॉडी शरीर के अंदर आते हैं। ओके, सो दैट्स वन इम्पोर्टेंट थिंग। इसीलिए ये सारे जो हाथ 20 सेकेंड्स के लिए हाथ धोने और सोशल डिस्टेंसिंग और मास्क पहनना जरूरी है, क्योंकि और पर्टिकुलरली आपको अपनी आंख, नाक और मुंह को नहीं छूना चाहिए, क्योंकि इवन इफ अगर आपके हाथ पे, समझो आपके हाथ पे वायरस पार्टिकल्स हैं, वो आपको तब हार्म कर सकते हैं जब आप उनको अंदर जाने देते हैं। ओके, सो दैट्स अ वेरी इंपॉर्टेंट पॉइंट टू रिमेम्बर, कि ऐसे डर में नहीं घूमना चाहिए कि हर जगह कोविड है और इंस्टेंटली जब मैं बाहर जाऊंगा तो मुझे कोविड हो जाएगा। नहीं, इसीलिए जैसे मैंने कहा था, आपको समझदारी और सावधानी से बाहर जाना पड़ेगा, लेकिन आपको ये नॉलेज लेके जाना पड़ेगा कि कैसे हम प्रिवेंट कर सकते हैं इस रिस्क को, और कैसे हम इस रिस्क को मिटिगेट कर सकते हैं। जो दूसरी point I want to make about this is about the transmission chain, कि ये जो illustration है, इसमें it is showing very nicely कि every country had this issue about flattening the curve, and I don't think people understood कि ये flattening curve किस वजह से है और ये pandemic क्यों कहलाता है। ये पैंडेमिक इसीलिए कहलाता है क्योंकि जो ट्रांसमिसिबिलिटी है और ये जो रिप्रोडक्टिव रेट है ये कोविड का, ये ऐसे है कि जो अगर एक इंसान को कोविड है, मानो कि ये एक इंसान को कोविड है, वो एक इंसान 2 या 3 और इंसान को इन्फेक्ट कर सकता है। ओके, so that is the reproductive rate of 2.3 or 2 to 3. Okay, so as you've seen in this tree, each time the people that are infected are infecting another 2-3 people, और इससे क्या होता है कि ये जो spread होता है exponential होता है, और इसीलिए ये जो pandemic है दुनिया में accelerate हो रहा है। Okay, so बिना कंट्रोल के ये तो एक्सेलरेट होता ही रहेगा। लेकिन अगर हम ये मास्क पहनना, वॉशिंग हैंड्स एंड वॉचिंग डिस्टेंस सीरियसली लेंगे, तो हम ये चेन ऑफ ट्रांसमिशन ब्रेक करेंगे और ये रिप्रोडक्टिव रेट नीचे हो जाएगा। सो फ्लैटनिंग द कर्व मींस इट विल बी फ्लैट अगर एक इंसान सिर्फ एक ही इंसान को इन्फेक्ट करेगा, और ये पैंडेमिक जब तब खत्म होगा जब ये रिप्रोडक्टिव रेट 1 से नीचे होगा, और तब ये growth of virus will no longer be exponential. ठीक है? So, and the same thing that this concept is shown about the virus particles. एक virus particle, multiple times it will replicate inside your cells, and I will bring this issue back when we talk about reduction in viral load. ठीक है? So again, this is the flattening curve reproductive rate of the virus. It's shown that if we don't do anything, then the virus will keep on spreading. Okay? And this will be an exponential curve. If we follow the rules, then the pandemic can be controlled. But the point is that it is a marathon. ये short term race नहीं है. जैसे कि न्यूजीलैंड में हमने सक्सेसफुली वायरस को एलिमिनेट किया था, लेकिन फिर अभी एक न्यू क्लस्टर और न्यू कम्युनिटी ट्रांसमिशन आए, तो दोबारा से we had to do lockdown. So same way, it will keep on going. And we have to keep these measures going. So that's the reality for the pandemic. Now, in terms of transmission, there are three main ways, जिससे ये virus transmit होता है. एक है surface transmission, and that is the least important method. दूसरी है droplet, जो at the beginning of the pandemic शुरू में WHO ने सोचा कि ये ड्रॉपलेट ट्रांसमिशन सबसे सीरियस है, और इसीलिए वो जो 2 मीटर की दूरी, ये जो ड्रॉपलेट है, ये जो अब जब आप बोलते हैं या खांसते हैं या छींकते हैं, तो आपकी जो रेस्पिरेटरी ड्रॉपलेट है उसके अंदर वायरस पार्टिकल्स होते हैं. लेकिन ये जो थर्ड ट्रांसमिशन रूट है, जो एरोसोल रूट है, जब हम ब्रीथ करते हैं या बात भी करते हैं, तो फिर smaller particles are released and they are called aerosols, और उसके अंदर भी virus particles होते हैं. तो ये तीन transmission routes हैं COVID-19 के that I will go through quickly. So surface transmission, there was a lot of fear about that initially. This is no longer considered the primary cause of transmission, but it is still something that we have to be aware of. So for example, in the air, COVID 3 घंटे के लिए रह सकता है, copper पे 4 घंटे के लिए, जो cardboard है उस पे 24 hours के लिए रह सकता है, और जो stainless steel है और plastic है up to 3 days, up to 3 दिन. लेकिन ये समझना जरूरी है कि अगर जैसे आपने groceries वगैरह कुछ लिया है बाहर से, जो पहले दिन पे वो प्लास्टिक का आइटम 3 दिन बाद वो जो वायरस पार्टिकल्स हैं वो gradually decrease हो रहे हैं concentration में through that time, over that period of time. So that's something important to remember. तो respiratory droplet, जैसे हमने बोला कि जब आप बोलते हैं या खांसते हैं, छींकते हैं, ये जो बड़े respiratory droplets हैं, ज़्यादातर ये 2 मीटर की दूरी से आगे ड्रॉप होते हैं जमीन पे. लेकिन काफी ड्रॉपलेट्स हैं जो छोटे ड्रॉपलेट्स हैं, वो आपके आसपास के हवा में घूमते हैं और किसी और को इन्फेक्ट कर सकते हैं. तो इसीलिए मास्क पहनना जरूरी है. Now, अब क्या हो रहा है कि ये aerosol spread जो पहले WHO wasn't admitting कि it is a big issue. Actually, this is quite a big issue, this aerosol spread. तो particularly जैसे आप इंडिया में अब लॉकडाउन जो खत्म हो चुका है और लोग काम पे जा रहे हैं और मार्केट्स वगैरह खुले हैं, आपको ध्यान रखना होगा कि you must these are the high risk areas, crowded areas जो indoors होते हैं functions जिसमें ventilation कम है, जैसे कि AC buildings हैं, जो काफी भीड़ और लोगों जो close proximity में रहते हैं, जो long duration की function होती है, जो काफी घंटे के लिए चलता है, और जब लोग unmasked होते हैं, और काफी जो super spreading events हुए हैं जहाँ लोग there are the singing or yelling, जैसे कि concert होगा या भजन सत्संग कुछ ऐसे, क्योंकि उसमें respiratory droplets ज्यादा होंगे. So these are the things that you have to think about to try and reduce your risk when you're out and about. For example, अगर आपको किसी से मिलना है या it's far better that you meet in an open area than in a indoor, unventilated location. Or, for example, if you have to catch a taxi or an Uber, you keep the window open. So that is the application of that knowledge in a practical sense. So now हम prevention की steps cover करेंगे. तो जैसे disaster management and also in medicine, prevention is better than cure. Or actually, अगर देखा जाए तो COVID में prevention is actually a cure in a sense. Like if you can try and get through this pandemic without picking up COVID, वो ज़्यादा better होगा basically. So these are the steps. Now, back इस कार्टून में मैंने दिखाया था कि ये कोविड पार्टिकल कुछ ऐसे लगता है. इसका प्रोटीन लेयर होता है, अंदर उसकी आरएनए जेनेटिक मटेरियल होता है और उसकी स्पाइक प्रोटीन होता है और इसकी बाहर की लेयर पे एक फैटी एनवेलोप होता है. Now ये इस फैटी एनवेलोप इस वायरस का पॉइंट ऑफ वीकनेस है और इसीलिए हमको अपने हाथों को 20 सेकंड के लिए धोना जरूरी है, क्योंकि इससे क्या होता है कि ये जो वायरस पार्टिकल्स हैं ये एक्चुअली डिस्ट्रॉय हो जाते हैं. It actually destroys it. It breaks the membrane and it can no longer infect you. But the 20 seconds is important. Now, न्यूजीलैंड में और हम सबको बताया गया कि सिखाया गया रादर कि हाथ धोने के लिए आपको 20 सेकंड आपको हाथ धोने हैं और फिर आपको ठीक से ड्राई भी करना है. दैट इज ऑल्सो अ वेरी इंपॉर्टेंट स्टेप, क्योंकि अगर आप अपने हाथों को ठीक से ड्राई नहीं करेंगे तो मॉइस्ट जो आपके हाथ होंगे उस पर ज़्यादा चांसेस है आपको और वायरस पार्टिकल्स पिकअप करने के लिए. तो हमें सब को बताया गया कि आप मन में 2 बार हैप्पी बर्थडे टू यू आपको गाना चाहिए, क्योंकि वो sort of 20 seconds के लिए duration होता है. लेकिन I thought to make it relevant, because actually to wash your hands for 20 seconds is quite difficult. So just to give you an example, I would encourage you for your own family और अपने बच्चों के लिए कोई भी जो गाना आपकी पसंद की है आप अपने मन में आपको गाना चाहिए जब आप अपने हाथ धो रहे हैं, ताकि आपको ये like you are doing it properly, because this is very important. And particularly ये आपको करना चाहिए before you touch अपने आँख या नाक या मुंह. ठीक है, तो ये आपके लिए एक एग्जाम्पल का वीडियो मैंने बनाया है. So as you can see, I mean, 20 seconds is quite a long time. So, अगर आप अपने मन में 2 बार एक कोरस को गा सकते हैं और, ये simple चीज़ है लेकिन बहुत बहुत important चीज़ है. And I cannot stress this enough कि, you must teach your children, everyone, जो भी आप, लोगों को सिखा सकते हैं. ये सबसे इम्पोर्टेंट बात है ये जो हाथ धोने की. particularly आपको आपके हाथ साफ होने चाहिए बिफोर आप अपने आँख या नाक या मुंह को छुएंगे. और आप सोच सकते हैं कि बाहर हम जाके किसी से हैंडशेक कुछ नहीं करेंगे, सिर्फ नमस्ते बोलेंगे और मन में हम सोचेंगे amen. Avoid our mouth, our eyes and our nose. Okay, so that's one simple thing. Secondly, जो physical distancing जैसे हमने explain किया था, it is very important. But it is important कि although हम physical distance maintain कर रहे हैं 2 मीटर के, कि हम socially connected रह रहे हैं. And we are living in an age of technology where we can remain socially connected even though we are physically distant from each other. And remaining socially connected is very important for our immune health. जो तीसरी और I would say अभी at this stage of the pandemic one of the most important tools we have is ये mask पहनने की. तो मैं चाहूँगी कि थोड़ा देर I'm going to spend ये जो mask पहनने वाले जो myths हैं आपको I would like to just go through and debunk all जो myths हैं around masks क्योंकि masks are a very simple and effective tool that can protect you and can save lives, not just yours but everybody's. तो एक पहला जो मिथ है लोग सोचते हैं कि मास्क पहनने से आपका ऑक्सीजन इंटेक डिक्रीज होता है, ये बिल्कुल गलत है, ये नहीं होता है. और आपको इंक्रीज इन टॉक्सिक इनहेलेशन ऑफ कार्बन डाइऑक्साइड होता है, ये भी बिल्कुल फॉल्स है. जो कार्बन डाइऑक्साइड है वो हार्मलेसली मास्क के थ्रू एस्केप होता है. ये मास्क पहनने से आपकी इम्यून सिस्टम को कोई डैमेज नहीं होता है. मास्क पहनने से आप वायरस स्प्रेड नहीं करेंगे क्योंकि आपको पता भी नहीं होगा कि अगर आपको वायरस है क्योंकि 40% लोग हैं वो एसिम्प्टोमेटिक होते हैं और आप जब वायरस आप स्प्रेड कर रहे हैं काफी लोग तब स्प्रेड कर रहे हैं जब वो प्री सिम्प्टोमेटिक हैं और आप 2-3 दिन वायरस सिम्टम्स डेवलप होने से पहले आप इन्फेक्शियस है और आप स्प्रेड कर सकते हैं. इसीलिए मास्क पहनना जरूरी है और आपको अस्यूम करना है कि आपको कोविड है और सबको कोविड है. और दूसरी चीज जो इम्पोर्टेंट है कि अगर आपने इंटरेक्ट भी किया होगा किसी और से जिसके जो इन्फेक्टेड है और उसको पता नहीं है, अगर आपने अपने आप मास्क पहन रखा होगा तो आपका जो वायरस लोड है उस इंटरेक्शन में कम हो जाएगा एटलीस्ट 30% से. एंड दैट इज वेरी इंपॉर्टेंट क्योंकि अगर आपको कम वायरल डोज मिलेगा आपका जो इन्फेक्शन है उसका सिवियरिटी कम होगा. So it's a very effective tool. Now, just to prove that it doesn't affect your oxygen, I've just shown this short video, okay? And in this video, he will put on 5 surgical masks, and I would like you to watch his saturation level, which is here. ये दूसरा मास्क हो गया. अब ये तीसरा हो गया. अब ये चौथा हो गया. So actually he puts on 6 masks and his oxygen saturation doesn't drop. Now another big question people often ask is ये mask या कोई mask नहीं या सिर्फ face shield. तो इस वीडियो में इस gentleman ने demonstrate किया. उसने he is coughing over a tray of liquid nitrogen with no mask and with wearing a mask and then with only a face shield, and you can see clearly that the best protection is with a mask. Okay? Now this is a very important diagram I want everybody to understand. So if this person on the left is infected with coronavirus, उसको COVID है, और दूसरा इंसान उसके सामने खड़ा है, तो उसका ट्रांसमिशन रिस्क 90% है कि इसको भी कोविड हो जाएगा. अगर ये जो अनइन्फेक्टेड आदमी है उसने मास्क पहन रखा होगा तो इसकी रिस्क, that risk now drops to 30%. He has now a 30% chance. So by wearing a mask, he's reduced his chance from 90% to 30%. Now suppose the person who is infected wears the mask, वो ट्रांसमिशन रिस्क अब 5% तक गिर गया है. अब अगर दोनों ने मास्क पहन रखा होगा तो वो ट्रांसमिशन रिस्क 1.5% तक चला गया. अब आप उस मास्क पहनने में, if you add in the 2 meters of distance, you've further reduced your risk to 0, basically. So you can see how important masks are, especially when lockdowns khatam ho chuke hain, and also in populations where there is a high density and you are unable to avoid close contact with people. So I will just quickly go through this demonstration on mask wearing.
ठीक है, और ये इन्वायरमेंट के लिए भी अच्छी होगी, या आप डिस्पोजेबल मास्क भी ले सकते हैं, जैसे कि सर्जिकल मास्क होती है, लेकिन ये एक सिंगल यूज होता है, और ये बहुत इम्पोर्टेंट चीज है आपको समझना। ये जो अगर आप क्लॉथ मास्क लेंगे, ये आप अपने आप भी बना सकते हैं। अगर आपके पास एक बड़ा सा कॉटन का रुमाल है तो उसको फोल्ड करके भी आप बना सकते हैं। जो आइडियल मास्क है, ये कॉटन फैब्रिक होते हैं और उनकी 3 लेयर्स होते हैं। और जब आप मास्क पहनेंगे तो ये काफी इम्पोर्टेंट है कि पहले आपके हाथ साफ होने चाहिए, और फिर जब आप मास्क पहनेंगे आप ऐसे पहनेंगे ताकि वो अच्छी फिटिंग होगी, ठीक है। और अगर आप बाहर होंगे, अगर आप चश्मा भी पहन सकते हैं तो चश्मा भी अच्छा है। कोई भी चश्मा अगर आप पहनते तो वो भी अच्छा होगा, क्योंकि फिर आप अपने आंख को नहीं छूएंगे और थोड़ा सा और प्रोटेक्शन होगा आपके लिए। सन ग्लासेस हो सकते हैं, कोई भी ग्लासेस, ठीक है। जब आप अपने मास्क को जब आप बाहर हैं तो ये मास्क के साथ आपको फिडल नहीं करना है, कुछ छूना नहीं उसको। आपको ये समझना है कि ये बाहर का जो पोर्शन है उस पर कोविड है, और अगर आपको खांसना है या छींकना है, मास्क नहीं उतारना है। अगर फोन पे बात करना है, मास्क नहीं उतारना है। जब आप घर वापस जाएंगे और मास्क उतारेंगे तो पहले अपने हाथ को साफ करेंगे, फिर आप कानों से उसको उतारेंगे, ऐसे करके, ठीक है। और इसको सीधा, ये जो क्लॉथ वाला है उसको सीधा आप वॉशिंग में डालेंगे और वॉश करके उसको ठीक से ड्राई करेंगे, ताकि आप नेक्स्ट डे फिर से पहन सकते हैं। और अगर आपने ये वाला सर्जिकल वाला डिस्पोजेबल मास्क पहना है तो ये सिंगल यूज है। इसकी जो है एक ऊपर साइड है, एक नीचे साइड है। जो ऊपर साइड है इसमें एक वायर है और वो नाक पे माउंट हो जाता है, ठीक है।
Okay, so that's the main rules to understand कि मास्क पहनने से पहले आपको अपने हाथ धोने, और मास्क जब आप उतारेंगे आपके हाथ पहले साफ होने चाहिए। आपको अपने मास्क के साथ फिडल नहीं करना है। जो मास्क है आपका नोज और माउथ को कवर करना चाहिए, और ये जो वाल्व वाले मास्क हैं वो बिल्कुल ही नहीं पहनना चाहिए, क्योंकि ये सिर्फ एयर that's going in filter करते हैं, but not air that is coming out, so you can potentially infect others if you do have such masks. इसमें से आपको valve निकाल के उस पे आप fabric cover कर सकते हैं, ठीक है। So then the next concept I just quickly wanted to share with you is a New Zealand concept of the COVID safe bubble, जिसमें आप यूं समझ लीजिए कि आपकी फैमिली एक सेफ सुरक्षित बबल में है और उसके अंदर हमें कोविड नहीं चाहिए। तो
समझना है कि आपकी घर और आपकी परिवार एक बबल के अंदर है, जैसे कि ये मैं दिखा रही हूँ। जैसे कि आपकी घर और ये एक बबल है, और इस बबल को आपको साफ सुथरा रखना है, और इस बबल के अंदर हमें कोरोना वायरस नहीं चाहिए। तो ये बबल को सेफ रखने के लिए क्या होगा कि जब आप घर से निकलेंगे और फिर वापस आएंगे, आपको बहुत केयरफुली अपने आप को डिकंटामिनेट करना पड़ेगा बिफोर आप घर को एंटर करें।
Okay, so that's the bubble concept. So we need to be very careful जब हम घर enter करेंगे तो we will decontaminate ourselves. Now it's also very important कि घर में आपके adequate cleaning products हैं और आप ठीक से clean कर रहे हैं। I have a video on my YouTube which I would all suggest that you watch, because I have made it such that I have demonstrated जो common household डिसइंफेक्टेंट्स हैं, आप कैसे उनको स्प्रे बॉटल फॉर्मुलेशंस में बना सकते हैं। और ये स्प्रे बॉटल फॉर्मुलेशंस एक तो एनवायरनमेंट के लिए अच्छे होते हैं, और दूसरी चीज़ है जो surfaces हैं, they have to be saturated for 10 seconds with the cleaning product to kill the virus before you wipe it off. So it is ideal that they are in a spray bottle, and that's what I have demonstrated in this video. And I have shown exactly how to make up, for example, diluted methylated spirits or bleach solution भी मैंने demonstrate किया इस video में, जैसे कि जो 4% sodium hypochlorite solution होता है bleach में, उसका solution बनाने के लिए आपको 25 ml यानी कि 5 teaspoon bleach solution को 1 लीटर पानी में spray bottle में अगर आप बनाएंगे तो आप आसानी से घर में सफाई कर सकेंगे इससे। And that's also very important. अगर किसी को infection है घर पे, then you need to be very careful that you are cleaning the surfaces effectively to reduce the risk of other family members getting infected. Same with when your vegetables come in. The reason I included this slide is it's very simple to clean your vegetables just in some, water with a little bit of जो dishwashing detergent है, थोड़ा सा उनको सिंक में थोड़ा सा आप धो सकते हैं और फिर उनको ठीक से रिंस करके ड्राई करके स्टोर कर सकते हैं, क्योंकि काफी लोग हैं जो सोचते हैं कि 5 दिन बाद वो फल सब्जियां खाएंगे। ये अच्छी बात नहीं है, क्योंकि उनकी जो न्यूट्रिशन वैल्यू कम होगा उससे, और इट्स वेरी इंपॉर्टेंट कि हम अपनी इम्यूनिटी को स्ट्रॉन्ग रखना चाहिए। तो इट इज इम्पॉर्टेंट दैट यू मैनेज your fresh produce properly, but there's no need to get too concerned about it because surface transmission is not the key format of transmission. Now what happens अगर आपको लगता है कि आपको कोविड है, तो जो कोविड के सिम्टम्स है, जो जैसे आपने पूछा है कि मुझे कैसे पता चलेगा कि मुझे माइल्ड कोविड है। Well, I mean, आपको यही पता नहीं होगा कि आपको कोविड है कि नहीं है, क्योंकि कोविड की सिम्टम्स are like dry cough, सूखी खांसी, जो बुखार, जो नाक का बहना, गले में दर्द, breathlessness, सर में दर्द, body ache, sneezing, tiredness, diarrhea, या sense of smell भी जा सकता है। ये काफी सारे सिम्टम्स कोविड के हो सकते हैं, लेकिन सबको नहीं होते हैं। और ये एक टेबल है जिसमें दिखाया जाता है कि कोविड, फ्लू और कोल्ड, ये तीनों में काफी सिमिलर सिम्टम्स हो सकते हैं। और जैसे कि मेडिसिन में कहते हैं कि दैट बेसिकली देयर इज वेरी लिटिल ब्लैक एंड व्हाइट। तो अगर आपको कोई भी अपर रेस्पिरेटरी ट्रैक्ट की जो सिम्टम है, तो मेरा मानना है कि आपको अस्यूम करना है कि आपको कोविड है, और आपको अपने आप को अपने फैमिली मेम्बर्स से आइसोलेट करना चाहिए, और वर्चुअली या फोन के जरिए आपको कुछ मेडिकल एडवाइस लेना चाहिए, या आप टेस्ट एक्सेस कर सकते हैं, एंड यू शुड स्टे आइसोलेटेड एंड वेयर अ मास्क जब तक ये आपका टेस्ट नेगेटिव नहीं आ जाता। अगर आप टेस्ट एक्सेस नहीं कर सकते, then I would still assume कि आपको कोविड है, और आप हर एक प्रिकॉशन और मैनेजमेंट स्टेप आप लेंगे ताकि वो इन्फेक्शन सिवियर ना हो। तो जो मेरे वीडियो में जो मैं अभी I will go through, that plan is applicable to any upper respiratory tract infection. That plan is not just for COVID. Okay? Now, just on the spike protein, ये जो spike protein है, ये जैसे कि ये infection का जो है चाबी, और जो हमारे जब वायरस एंटर होता है हमारे आँख या नाक या मुंह के अंदर, जो सेल्स होते हैं हमारे नाक और मुंह के अंदर, उनमें ये एस रिसेप्टर होते हैं, ACE2 रिसेप्टर, और ये जैसे कि एक लॉक होता है, यानी कि ताला। और that spike protein, वो spike protein basically enters that, attaches to that, the chabi attaches to that lock basically, and opens it and allows it to enter the cell. Okay, and that is why, as you can see, where all these cells are lining in the body, that is where you see the main symptoms, जैसे कि running nose, cough, sore throat, diarrhea, वगैरह. That's because that is where all these receptors are. And that is why we have to work very hard to try and reduce the impact and reduce the number of virus particles that are entering our upper respiratory tract. जब ये infection almost हर एक body के system infect कर सकता है. लेकिन, and this is quite a scary picture, but the main point I want to make from this is that from our point of view, if your immune system manages to fight the infection in the upper respiratory tract, then we can prevent it leading to all these other parts of the body.
And Dr. Sandhya, if I can make a little bit disturbance here. Actually, prevention. We all are listening, but we will be more interested in listening your
management. Okay, I'll go on to the management then. So I've assumed but it's important to understand that when do you start management? Okay. So that's why it is important for you to understand that, the moment somebody gets infected, because you're talking about overwhelmed hospital systems, that is when you put your plan of action into place. So I have suggested recommended equipment to have at home is a pulse oximeter, which is easily available in the market.
And also, Dr. Sandhya, be bilingual as much as you can.
हाँ, ठीक है. जो pulse oximeter है, and अभी मैं हिंदी में demonstrate करूँगी. वो मार्केट में अवेलेबल है और काफी लोगों की फोन पे भी ये अवेलेबल है. And some balloons or ये straws. लेकिन जब आपको first symptoms होते हैं तो आपको medical advice लेना है. ठीक है? तो इसमें मैंने describe किया.
ऑक्सीमीटर ये डिवाइस कोई बहुत महंगा नहीं है और बहुत ही आसानी से सभी मेडिकल स्टोर्स पे अवेलेबल है. ये आपको हेल्प करेगा ये बताने के लिए कि ब्लड के अंदर आपका ऑक्सीजन सैचुरेशन लेवल कितना चल रहा है और एक रीएश्योरेंस देगा कि आप अपना केस अच्छी तरह से घर पे मैनेज कर पा रहे हैं और आपको बार-बार हॉस्पिटल जाके इस सैचुरेशन लेवल को चेक करने की जरूरत नहीं है. अब मैं आपको बताती हूँ ये डिवाइस कैसे फंक्शन करता है. तो इसमें एक स्विच होता है, उसे ऑन करेंगे. यूजुअली इसके साथ में या तो बैटरीज आती है या एक कॉर्ड होता है. इसमें एक स्लॉट दिया होता है, उसमें आप अपनी इंडेक्स फिंगर डालेंगे. थोड़ी देर के बाद इसमें एक लाइट चलेगी और आपकी जो भी रीडिंग है वो इसमें आ जाएगी. जैसे मेरी रीडिंग इस टाइम पे 100 आ रही है और नीचे मेरा पल्स रेट आ रहा है, तो मेरा लंग फंक्शन बिल्कुल ठीक काम कर रहा है. ये एक बहुत ही इंपॉर्टेंट डिवाइस है अपने लंग फंक्शन को मॉनिटर करने के लिए इस इन्फेक्शन के दौरान. नॉर्मल रेंज है बिटवीन 95 to 100%. अगर आपका लंग फंक्शन इसमें 93% से कम दिखा रहा है और उसके साथ में सांस लेने में तकलीफ है, तो ये एक इस चीज का इंडिकेशन है कि आपको एक एक्सपर्ट मेडिकल एडवाइस, प्रॉपर प्रोफेशनल मेडिकल एडवाइस बाहर जाके लेने की जरूरत है.
ओके, एंड ये पल्स ऑक्सीमीटर इसलिए जरूरी है क्योंकि जैसे आपने पूछा कि हमको कैसे पता चलेगा कि हमको माइल्ड इन्फेक्शन है. तो ये पल्स ऑक्सीमीटर इज वेरी इंपॉर्टेंट क्योंकि जो one of the worst effects that COVID has is on the lungs, and unfortunately जो effect होता है वो silent होता है. तो आप without having an oximeter to determine your oxygen level in your blood, it is very hard to understand whether your infection is mild or severe. So if you start seeing that your oxygen saturation कम हो रहा है, 93 या 92 से कम हो रहा है और उसके साथ आपको सांस लेने में डिफिकल्टी हो रहा है, तो that is an indication that you do need to get medical advice straight away, and this is not a mild infection. But just remember, only 1 in 5 people, यानी कि सिर्फ 20% लोग हैं जिनको hospital level treatment जरूरी है. So next step is the most important step, is about your immunity.
अब सबसे पहला मैनेजमेंट प्रिंसिपल इस कंडीशन को घर पे ही मैनेज करने के लिए ये है कि आपको अपनी इम्यूनिटी को बढ़ाना होगा. हमारी बॉडी की इम्यूनिटी फर्स्ट लाइन ऑफ डिफेंस है किसी भी बीमारी से लड़ने के लिए, और ये बात कोविड-19 वायरस इन्फेक्शन के लिए भी लागू होती है. अपना जो डाइट है उसको कोशिश करें कि बैलेंस डाइट लेने के लिए हर तरह के फल और सब्जियां इंक्लूड करें.
ये भी कोशिश करें कि जंक फूड ना खाएं, अल्कोहल और फिजी ड्रिंक्स को कम से कम यूज करें, वेल हाइड्रेटेड रहें, पानी बहुत ज्यादा मात्रा में पिए। इसके साथ में ही एक चीज और बहुत इंपॉर्टेंट है कि अपने आप को काम और कंपोज रखना है, क्योंकि इस समय में काफी कुछ आपका माइंड डिसाइड करेगा कि आपकी बॉडी इस कंडीशन में कैसे रिएक्ट करती है। मैं आपको और कुछ ब्रीथिंग एक्सरसाइजेस भी बताऊंगी जो आपको काफी मदद करेंगी इस इन्फेक्शन के दौरान। अपने इम्यून सिस्टम को मजबूत करने के साथ आपको एक अच्छी कम से कम 8 घंटे की नींद लेना भी बहुत जरूरी है। अब मैं आपको कुछ इंपॉर्टेंट सप्लीमेंट्स के बारे में बताती हूँ। सबसे पहले है ये जिंक, विटामिन डी और विटामिन सी।
तो just briefly on vitamin D, जो vitamin D है, ये जो immunity is very important और हम सबको अपना immunity पे अभी काम करना चाहिए, and that's by following healthy lifestyle as I mentioned. और जो बाकी की supplements जो मैंने mention किया था, vitamin D, vitamin C और zinc, vitamin D is very important, particularly in India, because there is काफी लोग vitamin D में deficient है, almost 80% of the Indian population, और ये vitamin D बहुत important है हमारी immunity के लिए। तो I would suggest कि सब लोग should check up कि अपने vitamin D levels सही होने चाहिए, and you should not enter a COVID infection with a low vitamin D level, क्योंकि धूप सेकने से विटामिन डी नहीं बनता, और डाइटरी सोर्सेज इंडियन डाइट में pretty much नॉन एग्जिस्टेंट है। जो जिंक और जो विटामिन सी है, वो दोनों they both help fight the infection through different mechanisms, and those supplements मैंने suggest किए हैं जब आपको बीमारी है, not to be taken all the time, and they will help boost your immunity and help in various ways to fight the infection. But you can also take other things, whether it's haldi or kadha, whatever you want to take, but ये 3 चीजें important है। Second step, very important, reduction in viral load.
अब दूसरा मैनेजमेंट प्रिंसिपल है वायरस लोड को बॉडी में कम करना। आपको पता है कि कोविड-19 का वायरस आपको किसी दूसरे इंसान के ड्रॉपलेट यानी उसके बोलने, छींकने या खांसने से लग सकता है, और ये आपके नाक, मुंह या कभी आंखों के जरिए अंदर जा सकता है। तो अगर आप कहीं बाहर हैं और 2 मीटर का सोशल डिस्टेंसिंग मेंटेन नहीं कर पा रहे हैं, तो आपको फेस पे एक मास्क पहनना चाहिए, अगर पॉसिबल हो जो आपके नाक और मुंह को कवर करे, और अगर पॉसिबल हो तो एक चश्मा भी पहन सकते हैं। इससे ये होगा कि अगर आप किसी इन्फेक्टेड पर्सन के कांटेक्ट में आते भी हैं, तो जो ट्रांसमिशन का चांस है वो बहुत कम हो जाए, या जो वायरल लोड है, जो वायरस उससे आप तक आ रहा है, उसकी एंट्री कम हो जाए। अब अगर आपके फैमिली में किसी को कोविड-19 के सिम्टम्स दिख रहे हैं, जैसे कि बुखार का आना, सूखी खांसी, नाक का बहना, गले में दर्द या स्मेल या टेस्ट के सेंसेशन का कम हो जाना, तब आपको इस वायरल लोड को कम करने के लिए कुछ चीजें करनी होंगी। उसके लिए सबसे पहले आपको दिन में 2 बार गुनगुने गर्म पानी में नमक डाल के या बिटाडिन माउथ रिंस से गार्गल करने होंगे। अपने माउथ को रिंस करने के साथ साथ आपको अपनी नेजल कैविटी यानी अपने नोज को भी रिंस करना चाहिए। उसके लिए आप इस तरह के कुछ ओवर द काउंटर सलाइन नेजल स्प्रे ले सकते हैं। इसको आपको अपनी नॉस्ट्रल्स में दोनों साइड में ऐसे स्प्रे करना होगा, और ऐसा आप दिन में कई बार कर सकते हैं। इसके अलावा एक और दूसरा ऑप्शन ये है कि आप ऐसे सलाइन सॉल्यूशन को एक ड्रॉपर बॉटल में ले लें, उसके अंदर कुछ ड्रॉप्स ऑफ बिटाडिन डाल दें, कॉन्सेंट्रेट बिटाडिन। लिड को वापस अच्छी तरह से बंद कर दीजिए। अब इसको दिन में 2 बार, या आपको जब भी कभी बाहर जाना हो या बाहर से वापस आए हैं, तो अपने दोनों नॉस्ट्रल्स में कुछ ड्रॉप्स इसकी डाल लें। अब अगर आपके पास इस तरह के ओवर द काउंटर सलाइन वॉशेस अवेलेबल नहीं है, तो आप इनको घर पे भी बना सकते हैं। इसके लिए आपको चाहिए इस तरह का एक बड़ा प्लास्टिक बॉटल, जो कि स्प्रे बॉटल भी हो सकता है या पतले नोजल का बॉटल हो सकता है। उसमें आप 250 ml ऑफ उबाला हुआ और ठंडा किया हुआ पानी ले लीजिए, बॉइल्ड एंड कूल्ड वाटर।
उसमें ऐड कीजिए हाफ अ टी स्पून ऑफ सोडा बाइकार्बोनेट यानी खाने वाला बेकिंग सोडा और हाफ अ टी स्पून ऑफ नमक टेबल सॉल्ट। फिर कुछ बूंदे बेटाडीन कॉन्सेंट्रेट की। इन सभी चीजों को आप अच्छी तरह से बॉटल में मिला लीजिए और उसको अच्छी तरह से टाइटली बंद कर दीजिए। अब इसको यूज करने का तरीका ये है कि आप एक वॉश बेसिन या सिंक में आगे को झुक के खड़े हों और इस जो ये सलाइन वॉश आपने बनाया है इसको अपनी नाक के अंदर स्प्रे करें। इस तरह से करें कि ये पूरे आपके अंदर माउथ में और दूसरे नाक के जरिए से बाहर आना चाहिए। ये भी बहुत मदद करेगा वायरल लोड को कम करने में।
Okay, so and after that जो it's also important steam inhalation Vicks के साथ काफी important है। और जैसे कि इस डायग्राम में अगर आप एक भी वायरस लोड पार्टिकल आप कम करेंगे तो इतने सारे वायरस पार्टिकल्स आप अवॉइड करेंगे। So that step is very important. The other thing which is also very important is nasal decongestants, जैसे कि Otrivin होती है और antihistamines वगैरह, ये भी काफी important होते हैं है घर में रखने के लिए to fight any upper respiratory tract infection, क्योंकि इससे क्या होता है कि आपका जो नाक का बहना अगर आप कम करेंगे तो फिर आपका जो post nasal drip कम हो जाएगा और आपके चेस्ट में जाने की चांसेस भी कम होगा। So this is a very important step, is breathing exercises. And the breathing exercises जो मैंने describe किए थे अपने वीडियो में are basically all where you are focusing on exhalation, यानी कि breathing out. And it is a forced exhalation against resistance, यानी कि एक incentivized breathing है। जैसे कि अगर आपको कोई operation हुआ होगा और ये incentive spirometer आपने शायद देखा होगा जो doctors use करते हैं to help keep your lung bases working well.
एस्पेक्ट के बारे में बात करते हैं जो की है ब्रीदिंग एक्सरसाइजेस। उससे पहले मैं आपको बताना चाहूंगी कि आपका लंग कैसा दिखता है और किस तरह से काम करता है। हमारे लंग्स हमारे चेस्ट कैविटी के अंदर होते हैं और काफी बड़ा एरिया कवर करते हैं वहां पे। ये देखने में कुछ इस तरह से स्पॉन्ज की तरह होते हैं, ऊपर से पतले और नीचे ब्रॉड होते हैं। ज्यादातर एयर स्पेसेस हमारे बैक साइड की तरफ होते हैं। इन्फेक्शन की वजह से अगर लंग्स में कुछ फ्लूइड या पानी जमा होता है तो ग्रेविटी की वजह से वो नीचे यानी बेस ऑफ द लंग में जमा हो जाता है, जो कि पीछे कमर की तरफ है। इसलिए ब्रीथिंग एक्सरसाइजेस बहुत इंपॉर्टेंट है टू मेक श्योर कि फ्लूइड जमा ना हो सके और हम अपनी लंग्स को प्रॉपर्ली एम्प्टी आउट करते रहें ताकि बेस ऑफ द लंग्स में जो छोटे एयर स्पेसेस हैं वो कोलैप्स ना हो जाए। और ऐसा करने के लिए बहुत इंपॉर्टेंट है कि हम सही तरीके से ब्रीदिंग को मेंटेन करें। ब्रीदिंग मैकेनिज्म में ज्यादा इंपॉर्टेंट है प्रॉपर एक्सपिरेशन यानी ब्रीदिंग आउट, क्योंकि जब आप ब्रीथ आउट करते हैं तो आप कोशिश करते हैं कि अपनी लंग्स को पूरी तरह से एम्प्टी कर सके, खाली करें। मैं इसको आपको बेहतर तरीके से समझाने के लिए एक छोटा एग्जांपल देना चाहती हूँ। आप ये समझ लीजिए कि इस स्पॉन्ज को आपको पानी से भरना है और ऐसा करने के लिए आपको उसको पहले पूरी तरह से खाली करना होगा, एम्प्टी आउट करना पड़ेगा, स्क्वीज ऑफ करना पड़ेगा। यानी आपको अगर मैक्सिमम ऑक्सीजन अंदर चाहिए तो पहले आपको उसके अंदर का जो पुराना कार्बन डाइऑक्साइड है उसको पूरी तरह से निकालना होगा। अब मैं आपको डेमोन्स्ट्रेट करके दिखाती हूँ। मैं एक लंबी सांस बाहर छोड़ रही हूँ। थोड़ा रुकेंगे और लंबी सांस अंदर खींचेंगे, फिर रुकेंगे।
So I show the balloon breathing exercise, and this is a very useful exercise to keep the lung bases, air spaces open.
और पहले उनको जो प्रोसेस की हिस्ट्री दे चुकी थी और फिर भी हम उनका 100 एक बार फिर है कि हम पूरी कार्बन डाइऑक्साइड को बाहर निकाल दें ताकि ऑक्सीजन अंदर तक जाने की जगह रहे। और यही हम इस
टेक्निक के जरिए कर रहे हैं। इसी वजह से जब हम अब दोबारा अपना ऑक्सीजन सैचुरेशन लेवल चेक करेंगे तो वो ज्यादा बेहतर और बढ़ा हुआ आएगा। अगर आपके पास बलून नहीं है तो कोई प्रॉब्लम नहीं है, आप सिर्फ प्रिटेंड कर सकते हैं जैसे कि आप 3 सांस में बलून को फुला रहे हैं। अगर कुछ बुजुर्ग लोग ये बलून वाली टेक्निक को थोड़ा डिफिकल्ट पा रहे हैं और उनसे ये नहीं हो पा रहा है, तो उनके लिए दूसरा सिंपल तरीका है, एक स्ट्रॉ लेके एक ग्लास में या एक टम्बलर में पानी भर लें और बिल्कुल उसी तरह से 3 बार लंबी सांस बाहर फेंकनी है उस स्ट्रॉ के जरिए पानी में। यानी आप जो एक्सपायरेशन कर रहे हैं वो एक रेजिस्टेंस के साथ कर रहे हैं। एस्पेक्ट के बारे में बात,
ठीक है, so that's important, you know, but प्राणायाम भी ठीक है या आप ओम chanting भी ठीक है या but the point is that breathing exercises are important and it is a good preventer because you hear all the stories कि सब लोग breathing की वजह से hospital में है, तो why wait until your lungs are already decompensated? It's better कि आप उससे पहले breathing exercises करना चाहिए। और ये जो next or जो pain और fever के लिए you can take paracetamol और ये काफी important चीज जो मैंने बताया था वो है position का।
Did you show your vegetable washing techniques?
I did.
Okay, that's great.
एक और बहुत ही ज्यादा इम्पोर्टेंट चीज जिसका हमें ध्यान रखना है वो है हमारा पोस्चर, यानी हमारे लेटने का तरीका। यह है मेरी ब्यूटीफुल डॉल रानी और एक पिलो। तो जब हम बीमार हैं यानी हमें इस तरह का कोई लंग इन्फेक्शन है तो हमें इसका बहुत ध्यान रखना पड़ेगा कि हम ज्यादातर किस पोजीशन में लेटे हुए हैं। जैसा कि मैंने आपको बताया कि हमारे जो ज्यादा एयरवेज हैं, जो एयर पैसेज हैं, वो नीचे की साइड और पीछे कमर के पीछे की साइड लोकेटेड होते हैं। तो अगर हम बहुत ज्यादा देर अपनी पीठ के बल लेटे रहेंगे तो चांसेस हैं कि वो कोलैप्स हो जाए। तो हमें करना क्या है कि हमें ज्यादातर अपने पेट के बल लेटना है और उसके नीचे हमें एक पिलो या तकिया रखना है। कोशिश करिए कि तकिया इस तरह से हो कि वो आपके चेस्ट से लेके पेट तक आए ताकि कंफर्ट ज्यादा हो। ऐसा करने से आपके जो बैक का जो लंग का पार्ट है वो प्रॉपरली एक्सपोज्ड है और दब नहीं रहा है।
ठीक है, so prone position is important. ये जो मेरा वीडियो है पूरा अब it's in 8, I have had it dubbed with the help of friends in 8 different languages और ये सारे languages इंडिया में बोला जाते हैं। एक है हिंदी, इंग्लिश, तेलुगु, तमिल, मराठी, गुजराती, French and Portuguese, and I'm working on Malayalam, Kannada and Bengali, so nobody has an excuse to not have access to this information wherever they are in India. So
great, yeah.
So just another important thing which जो सवाल लोग पूछते हैं कि कितने दिन के लिए मैं infectious हूँ। अगर मानो कि हमने घर में मैनेज कर लिया है माइल्ड इन्फेक्शन और आपको पता चल गया होगा कि माइल्ड क्यों है, क्योंकि जो अगर वो पूरा जो 14 डेज है इन्फेक्शन के, अगर हर दिन आप अपना ऑक्सीजन सैचुरेशन चेक करेंगे और अगर आपको बुखार भी होगा, कुछ भी होगा, अगर आपका सैचुरेशन 95 से 100 रहेगा तो वो इट्स नॉट डेंजरस। फीवर इसीलिए होता है क्योंकि जब हमको कोई वायरस है, हमारा बॉडी का नेचुरल डिफेंस मैकेनिज्म है कि आप वो the body temperature rises because it is an unfavorable environment for the bug basically। लेकिन उससे क्या होता है कि हमें थकान वगैरह होती है, इसीलिए हम पैनाडोल लेते हैं। जो फीवर इटसेल्फ है उससे कुछ डैमेज नहीं होता, ठीक है। So the main thing is maintaining a close eye on your oxygen saturation and of course अगर आपको कुछ shortness of breath वगैरह होगा, तो जब आपका mild infection है जो घर में मैनेज हो रहा है, after 10 days from onset of symptoms, आप in mild cases या 3 दिन आफ्टर फीवर या कोई सिम्टम्स सेटल हो जाते हैं, जोन्स इसमें से जो भी लेटर होता है दैट इज सफिशिएंट टू इंडिकेट कि आप इन्फेक्शियस नहीं हैं, क्योंकि काफी बार लोग दे विल गेट रिपीटेड टेस्ट, पीसीआर टेस्ट वगैरह और वो पॉजिटिव रहते हैं, लेकिन दैट डजंट मीन कि आप इन्फेक्टिव हैं अभी तक, ठीक है। So that's just duration of infectivity is approximately 10 days from onset of symptoms. Just a quick point about loss of smell. क्योंकि काफी मेरे सोशल मीडिया पे काफी लोग पूछते हैं लॉस ऑफ स्मेल के एक स्टडी आया था where they looked at कि जैसे मैंने बताया कि जो एस रिसेप्टर वाले जो सेल्स हैं जो काफी नाक के अंदर हैं और इसीलिए ये लॉस ऑफ स्मेल होता है और लॉस ऑफ टेस्ट because there's a lot of these receptors on the tongue as well. But the good news is that the ACE receptors are not on the nerve cells of the inside the nerves, but on the support cells. तो इससे ये पता चलता है कि जो loss of smell है वो permanent नहीं होना चाहिए. तो मेरा मानना है कि एक तो अगर आप steam inhalation वगैरह करेंगे और अगर आपका sense of smell loss हो भी गया तो अगर आप proactively अपना smell को retrain करेंगे जैसे आप spices को smell करेंगे जैसे कि हींग होती है हल्दी होती है daily या twice daily आपका smell वापस आ जाएगा लेकिन it will take time but it will come back. एक दूसरा बात है लॉन्ग कोविड का जो किसी को भी हो सकता है एंड लॉन्ग कोविड इज डिफाइंड एज लोगों को सिम्टम्स होते हैं 3 हफ्ते से ज्यादा और फटीग हो सकता है काफी सारे डिफरेंट सिम्टम्स हो सकते हैं तो and approximately 10% of people are experiencing this prolonged illness and that is another reason why हमको avoid करना चाहिए ये infection. But most recover with just simple treatments and इसीलिए immunity पे काम करना काफी important है क्योंकि however strong we can make our immunity इसका chances कम होंगे इससे तो and these simple things like diet and sleep and quitting smoking and limiting alcohol they are very important.
Dr. Sandhya, you have next 2 minutes only.
Okay. So basically, if you can understand that there is a COVID triangle, where basically we are dealing with the virus, our environment, and us, the host. In terms of COVID, we can't change the virus, but we can reduce our risk by avoiding risky environments, and we can reduce our chances of, having a bad infection by improving our immunity. Working on controlling our chronic health conditions, making sure कि जैसे हमारी diabetes, हमारे sugars control में रहना चाहिए, हमारा asthma वगैरह control में रहना चाहिए, अगर हम smoke करते हैं उसको quit करना चाहिए और ऐसे हम अपना risk को कम कर सकते हैं. So basically, in conclusion, कि ये 3 takeaway हैं कि हमें ये नए जो कायदे अपनाने हैं वो है कि washing hands हमको distance watch करना है और ये मास्क पहनना बहुत जरूरी है क्योंकि अगर सब लोग हर व्यक्ति ये काम करेगा तो ये पैंडेमिक बिना वैक्सीन का कंट्रोल हो जाएगा. So yeah.
So that's okay.
But I basically want everybody to stay positive. There will be light at the end of this tunnel. And we will come out of this, and I just wanted to send my wishes and cheers from New Zealand.
How the sound is coming? How the sound is coming, I don't know. Anyways, thank you very much, Dr. Sandhya, for enlightening COVID-19 prevention and home management techniques. And on behalf of NIDM, I'm very, very thankful to you. And let me go ahead with a few things which we would be liking to reflect upon. The first thing from Sumit Gupta. Sumit Gupta, if you are listening me, and the second one will be coming from Milap Mukherjee. So first of all, Sumit Gupta, if you are listening me, how many questions we have received till now?
We have around 5 to 6 questions.
Speak loudly, please.
Sir, we have around 5 to 6 questions on the chat box and questions.
5 to 6?
Yes.
5 to 6 within the entire session?
Yes, only 5 to 6 questions.
Okay, so I'm again requesting all the participants that all your misconceptions, all your queries, all your questions should be on the platform. Please put it into the chat box. Chat box में आप अपने questions को डालें. यहाँ पे 5-5, 6-6 एक्सपर्ट बैठे हुए हैं आपके सारे क्वेश्चंस को लेने के लिए, जो आपको कोई टीवी नहीं दिखाता है. ठीक है, कोई टीवी आपको बताता नहीं है क्या होना है, कैसे होना है, कहाँ होना है. So please put all your questions and we will be taking all your questions. Questions को आप अपने chat box में डालें, जो भी participant मुझे यहाँ पे सुन रहे हैं. And next from the Milap Mukherjee, just down your background music from your side. I'm unmuting you again. So Milap, how did you find this since you are an ace of organizing the webinars and from the corporate world? So you are here also, and how did you find the entire presentation, and how would you actually reflect on that?
I think every child, when begins the day in our country as a day of learning, I think they must go through a lot of such informative videos and engaging and interactive information, which is the core solution to everything that is remaining aware. I'm really glad to be here along with all the panel, and I think you guys are doing an amazing job, and we must encourage everyone to spread the right awareness so people get to know more in detail about the situation we all are facing together. And I think we all are in this together. We will fight all this together.
Thank you very much. Thank you very much, Milap. Thanks a lot. Since you are ace into the field and how we are doing that, you can see it and you can always reflect on that. And the next feedback, I would like a quick feedback from now Dr. Vikas Maurya is here. He was Dr. Vikas. I'm not going to introduce you at this moment because it will take a lot of time. I'll be introducing you in our next of the September 12th webinar, which is quite related to that. But along with that, let me tell you that Vikas Maurya is one of the COVID warriors actually, who is fighting day and night 24/7 for serving the nation and serving the patients suffering from the COVID-19. So Vikas Maurya, just we would like a little bit feedback from you today's session.
Yeah, thank you, Dr. Raka. I think you can hear me well, and thanks everyone on the panelists, and of course, Sandhya. It was a very, very good, enlightening, the session, and very, very simple, very easy to understand for even for the general people, and I think such things are very, very important. At this time of pandemic, when there are a lot of misconceptions, a lot of fear among the mind of the people, and I think Dr. Ramanathan did quite well, in allaying those fears, and also about very simply sharing his her experience and about how you manage, how you take prevention. So that's become very, very important because as said very beautifully, that more important is to prevent, otherwise, because once you have that, and obviously in the case of the mild disease you can go on those things, but it becomes severe, then it's a problem. So a very good beautifully explained session. Yeah, thanks.
Thank you, Dr. Maurya. Actually, I didn't introduce you at length because in the next webinar we want to do that, and you will be the prime person who will be answering all those questions. I know that.
Yeah,
and I can see that we have received over 500 questions at the moment. So that's going to be a huge task for us. Along with that, next I would like to invite Dr. Namrata Sharma here. Just reflect on that. Just reflect on the session, and after that I'll go to Dr. Safiu
Yeah. Thank you so much, sir. First of all, I would like to thank Dr. Sandhya for such a wonderful presentation. I had a look at your video, and the way you just summarized it in this session, it was beautiful. And one of my favorite parts was that the part where you focus on the immunity, not just the physical part, but also how we need to be mentally strong and positive, because that impacts our physical immunity to a large extent. Just having a doctor who has worked in the field come here and talk about things that they have seen and applied on patients gives us a lot of confidence. I have learned so much. I will definitely pass on this information to many other people. And again, just thank you so much for being here. It was wonderful having you. Thank you.
Thank you, Namrata. Thanks a lot. I think Dr. Vikas Singhal is also here. Dr. Singhal. Dr. Singhal, in fact, told me that he is having some sort of ultimate crisis and he will be dealing with that. And we all know that right now doctors and the health facilities are into the acute crisis. And out of that, he has also given us time. Dr. Singhal, you are here. Just a few words from you, please.
Thank you, Dr. Raka. I really appreciate your invitation and for organizing this webinar. I think it's really important at this time for the entire country because we are seeing in our practice every day that COVID cases are rising exponentially. So, and the good thing is that we all know कि ज़्यादातर जो कोविड के पेशेंट्स हैं वो घर पे मैनेज हो जाते हैं, वो माइल्ड इन्फेक्शन ही है. तो लोगों के लिए अवेयरनेस ये बहुत ज़रूरी है समझना कि वो क्या प्रिकॉशंस लें और कैसे घर पे अपने आप को सेफली मॉनिटर कर सकते हैं, जो कि डॉक्टर संध्या ने अपने वीडियोस में दिखाया. और उनके क्वेश्चंस भी हम नेक्स्ट वीक आई थिंक डील करेंगे. But I think it has been a very informative webinar. Thank you for the invitation.
Thank you, Dr. Singhal, and thanks a lot for your feedback. Nonetheless, Dr. Murari, who is my colleague also, who is my friend also, he is also here. He was listening since the beginning, and Dr. Murari, I should say, he is a doctor, doctor with NDRF right now at a quite relevant position. And when we started our career, we were both juniors, and I know Dr. Murari very closely. And he has been the God for humanity, I should say, looking at his entire career and NDRF things and how we have dealt up the things together. So, Dr. Murari, a few words from you here.
Thank you, Dr. Raka. Really, I have attended so many webinars, but
Yes, go ahead, Dr. Murari.
Okay. There is some network issue.
No, perfectly all right.
Now it's clear?
Yeah, perfectly all right.
Okay. First of all, I give a claps to Dr. Raka, so that because he is one of my best friend and he is doing a great job. It's a really great job. And as far as the session is concerned, Dr. Sandhya इतना अच्छा, मतलब मैंने इतने अटेंड किए वेबिनार्स, बट जो डॉक्टर संध्या ने इस लेवल पे आकर के इन्होंने समझाया है बेसिक लोगों के हिसाब से, मतलब इसको मैं बहुत अप्रिशिएट करता हूँ. डॉक्टर साहब, आपने बहुत अच्छा काम किया है. एंड NIDM इस प्लेटफॉर्म पे, इस जगह पे आकर के जिस तरीके से डॉक्टर राका आपने सब पैनलिस्ट को लेकर के और जिस तरह का इनिशिएटिव ये किया है, इससे पहले हमने आपको नोएडा में भी देखा कि वर्ल्ड का सबसे बड़ा आपने मॉक ड्रिल कराया. तो आप जिस भी जगह पे लगोगे उस जगह पे काम बहुत अच्छा होगा, ये मुझे पता है. और अगेन मैं आपको कॉन्ग्रेचुलेट करता हूँ डॉक्टर राका कि आपने बहुत अच्छा काम किया. थैंक यू.
Sir, thank you very much, Dr. Murari. Actually, we will be having a lot of important questions for all of you in September 12th. And I'll not be taking a lot of time of you busy doctors. You are the COVID warriors, and I completely appreciate that how you are fighting this situation and surging cases of COVID-19 when hospitals are completely overwhelmed. You don't know what to do and how to do. Thank you very much. Thank you very much. With that, now I will come to Dr. Safi, who will be giving us a 10 minutes, 10 to 15 minutes reflection on today's talk and how we are going to deal with September 12th webinar. That is our second part actually. So Dr. Safi, Dr. Khaja Shafiuddin is a, since he is speaking, let me introduce him. He is currently working as a consultant emergency medicine at Apollo Hospitals, Hyderabad. Apollo Hospitals, Hyderabad, consultant emergency medicine, and he has served as chief of accident and emergency center at one of the esteemed units of Apollo Hospitals. He works as consultant faculty for disaster preparedness and incident management society of emergency medicine India, SEMI, what we call it, and at Institute of Disasters Emergency and Accidents, Disaster Emergency and Accidents, again IDEA, in India. He is responsible for assisting with various projects including disaster preparedness and response for the hospitals, community and state level authorities. He holds special interest in epidemic, and that is what we are talking about today, Dr. Khaja, and disaster response preparedness. And he's not allowed to say, he's also very interested in CBR and emergency as well, and he's very helpful for all of us. Dr. Khaja, we would like to listen. Yes, Dr. Khaja, go ahead. Your voice is not coming to us. Once again, no. We are not able to hear you.
Can you hear me now?
Now, perfectly all right. Go ahead.
Yeah. Good morning, everyone. I really appreciate Dr. Sandhya Swaminathan for bringing us a real new innovative idea to educate the affected people. Rather, they are frightened people to help themselves rather than they coming to the hospital in such a pandemic crisis wherein each and every healthcare system is challenged. So her talk was quite simple yet significant. She has made an underlying talk which is not deviating. Though her talk is explaining the home remedies, but every remedy, whatever she has discussed in her talk, holds a real clinical significant importance. It is never ever deviating anything from the existing medical guidelines. I really appreciate that, Dr. Sandhya. So your talk has been hovering around three aspects the way I have seen, that involves primarily about the priming of immunity in the individuals. You have discussed about the multivitamins and minerals that could be taken by the individuals, by the affected warriors to boost up their immunity. You have also added on.
ಸರ್ಟಿಫಿಕೇಟ್ ಪಕ್ಕಡೆ ಒಂದು ಇಂದು ಕಾಲೇ ನ್ಯಾಷನಲ್ ಡಿಸಾಸ್ಟರ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ದಾಖಲೆ
I totally agree with whatever the ideas you have
Government
shared.
of India.
Along with that, I also feel that there is a strong need for a routine, regular exercise.
To prevent
At least
COVID.
30 minutes after each meal, especially the people who are
Government of
affected
India,
by the COVID.
National Institute of
The reason behind
Disaster
is
Management.
most of the infections are associated with
admission
slowdown in
ಬರುವ
digestion process.
Just a minute, Dr. Safi. Someone is speaking on his mobile
Free
or
admission
computer.
Gokarna.
Please stop it. Whoever is
ನಮ್ಮ ಈ ಟೈಮ್ ಆನೆ ಪಣ್ಣಗ ಕೇಳಿದೆ ಅಕ್ಲು ನಡಿಲಿಕ್ಕೆ ಐತೆ ನಡಿ ಐಡ್ಲ ಕಡೆ ಅಪ್ಪಣತ್ತಲೆ
ಅರೆ
ನಮ್ಮ ಇತಿಹಾಸ ಗಟ್ಟಿಕೆಡ ಬಂದ್ಬಿಡೆ 1000 ರೂಪಾಯಿ ಹೆಚ್ಚೆ ಮಲ್ಪ್ಲೆ ಉಂಡೆ ಅಲ್ಪ ಸಲ ಅಕ್ಲೆ ಗೊತ್ತಾಗ್ತದೆ ಹೈಸ್ಕೂಲ್ ದಕ್ಲೆ ಅಕ್ಲೆ ಎಂಕಂಡ್ಲ ಬರ್ಪು ಹೈಸ್ಕೂಲ್ ಏದು ಏತ್ ಖರ್ಚಾಡಲ್ಲ ಇಂಗ್ಲಿಷ್ ಮೀಡಿಯಂ ಪಾಡ್ವೇರು ಡಿಗ್ರಿ ಗಾನಗ
let me find out but
ಪಕ್ಕ
all
ಶಾಂತಿ ಮೇಡಮ್ ಏನಂದ್ರೆ ಅರೆ ಅಕ್ಲಿಗೆ ಇದು ಇಲ್ಲಿ ನಕಲಮ್ಮ ನಮ್ಮ ರಿಯಾಲಿಟಿ ಗೊತ್ತಾಗ ಅಕ್ಲೆ ಗೊತ್ತಾಗ್ತದೆ
everyone
And
And who is this person? I can't.
and
please, all of you, please, if you are listening me, please, all of you, please mute your mic. Please mute your mic. Please mute your mic. You are disturbing 300 people here. Please mute your mic. You are disturbing 300 people here. Please mute your mic. You are disturbing 300 people here. Please mute your mic. Otherwise, you will be thrown out of the session. Please. Please mute your mic. I'm telling time and again, please mute your mic. Sumit ji, can you help? Can you help it out here?
So probably
no,
the
paper
mute at least.
There are 2-3 people who are able to find it, but I don't know how to find it.
Problem is that poor and on the COVID that the air labor they already
Please turn
Ita
off
varra
all
joke die
the participants, attendees. Please mute all the attendees.
Can I transfer hosting to you? Can you handle it?
Yeah.
Sumit ji?
Please, sir.
Fees day bannaga fees
Should
na
I
mallo
transfer
dala
hosting to you?
but samasya ente gottinde government college ide kadime kidikinaga andu work
This person I don't know.
ಐದು ಲಕ್ಷ ಗೋಕರ್ಣ ವಚನ ಕಾಲೇಜಲ್ಲಿ ಧರ್ಮವನ್ನ ಬಿಡೋಣ ನಮ್ಮ ಆಕ್ಚುಲಿ ಅಕ್ಕಲ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಕ್ಕಲ ಕೈಟ್ ಮಾಡಿದ್ರೆ ರೆಡಿ ನಮ್ಮ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಪೈಸಲ ಕಟ್ ಮಾಡ್ತೀವಿ ಅದು ತಕ್ಕದ ಎತ್ತೊಂದಿರ ದಟ್ಸ್ ಟ್ರೂ
Phone doctor.
ಅಕ್ಕಲ ಎತ್ತೊಂದಿರ
I'll be throwing out some persons. Sorry for that.
ನಾವು ಏನು ಎಲ್ಲ ತಗೊಳ್ಳೋದು ಫ್ರೀ
I'll be throwing out of the system.
ಫ್ರೀ ಅಂತ ಕೈಟ್ ಮಾಡ್ತೀನಿ ಸರ್ವಿಸ್ ಒಂಜಿ ಅತ್ತಕಲ್ಲ ಐತ ಮಿತ್ತಕಲು ಫ್ರೀ ಸರ್ವಿಸ್ ಮಿತ್ತೆ ಕ್ಲಾಸ್ಲ ಕೊಡ್ತಾರೆ that is the great
I'll be throwing out all the
free service amala ವಿಷಯ ಇತ್ತು
check by Lynn
ದೊಡ್ಡಿಗೆ ಹಾ ಅಂಚಾದಕಲು ಮಿಚ್ಚ ಬಿತ್ತವರು ಈಗ ಗೋಕರ್ಣ ಶರಕು 15 ಜನ ಪ್ರತಿ ವರ್ಷ ಮಾಡಿದ್ರು
persons whose mic are open because I have announced it so many times.
ನಮ್ಮ ಐತ ಬರ್ತೀವಿ ದುಬ್ಬದನ ಇದ್ದನಲ್ಲ ಅದು ನಂಗೆ ಆಕ್ಚುಲಿ ನಮ್ಮ ಸರಿ ಫ್ರೀ ಕೊರ್ನ ಕೊಡ್ತೀವಿ ಚೂರು ದುಂಬೈತೆ ಆಯ್ತಾ ಬದಲ ಅದನ್ನ ಅವು ಬೋರ್ಡ್ ಐಕ್ ಬೋರ್ಡ್ ಅಪ್ಪ ದೂರದೃಷ್ಟಿ ಮಾಡಿದೆ
Just give me 2 minutes. I'm doing that.
3 ದಿನ ಆಯ್ತು ನಂಗೆ ಗೊತ್ತಿತ್ತು
Find soon the noise is finished.
ನಮ್ಮ
all those
ಅದೇ
people
ಗೊತ್ತಿಲ್ಲ
mics are open. Please stop it. Throwing you out.
ಬಿಸ್ನೆಸ್ ಮಾಡ್ತಾರೆ ಎಜುಕೇಶನ್ ಕೆಲವು ಸಲ ಕೆಲವು ಸಲ ಬಟ್ ನಮ್ಮೊಂದು ರಿಸ್ಕ್ ತಂದು ಮಲ್ಪಡವು ಅಂತೆ ಬದಲು ಅದು ಲಾಸ್ ಆಗ್ತದೆ ನಮಗೆ ಮಕ್ಕಳಿಗೆ ಹಣ ಕೊಡಿ ಸಂಬಳ ಕೊಡ್ಲಿಕ್ಕೆ ಇಲ್ಲ ಮಾಡೋಣ ಸಂಬಳ ಕೊಡ್ಲಿಕ್ಕೆ ಅಕ್ಲೆಗಳ ಸಂಬಳ ಕೊಡ್ಲಿಕ್ಕೆ ಕೊಡ್ತಾರೆ ಫೀಸ್ ಕಟ್ಟಿದ ಸಂಬಳ ಕೊಡ್ತಾರೆ ಫೀಸ್ ಬಣ್ಣ ಅಕ್ಲಿದಲ್ಲ ಸಂಬಳ ಕೊಡ್ತಾರೆ ಅಕಡೆದಲ್ಲ ಸಂಬಳ ಫಸ್ಟ್ ಕಡಿಮೆ ಇದಲ್ಲ ಅಜ್ಜಿ
Sir, mute all the attendees, please.
ಮೇಗಪ್ಪ
Now let me throw whose mic is open. I am throwing them out. Just wait for a few minutes. And since you have to do all these things, so it's really difficult. Why people why they are opening their mics even after so many announcements? They don't understand. They are just disturbing 300 people here. So I think Dr. Khaja, it's now you can go ahead. You can continue with your thoughts.
Am I audible?
Yes, go ahead.
So I was emphasizing on the aspect of exercise. So most of the infections are usually associated with slowdown in digestion process. So how about having a walk of 30 minutes after each meal? What happens is like patient doesn't, when the digestion system slows down, the patient doesn't feel like having any more food. If the patient doesn't take more food, then the needing nutrition and the energy will not be supplied to the patient. If that doesn't happen, without energy, how can it fight? How can he or she fights with the germs? So what I suggest is a walk for 30 minutes after each meal, whether it is breakfast, lunch, and dinner, would really help them in boosting up the digestion process, which subsequently helps them in energizing themselves to fight against the invading germs. That would really be one of my take on this. And I had a question to Dr. Sandhya. So do you want to tell us that vitamins and minerals, whatever you have shown us right now, are they a sheer substitute for the existing nutritional diet balance?
Yes, Dr. Khaja, go ahead.
Can you hear me? Yeah. Dr. Sandhya, can you hear me?
I can hear
you completely, yeah.
Yeah.
Can you hear me?
Yes, I can hear you pretty loud and clear. So I wanted to understand, do you want to tell us that vitamins and minerals which an affected individual takes, are they going to be a substitute for the balanced nutritional diet?
Absolutely not. And I mean, 100% I made it clear in my management video that our immunity is our #1 defense against fighting any infection. So COVID is no different. And the basics of your immunity is eat well, sleep well, move more, love more, as in stay connected, and stress less. 5 things. Okay? Eat well is essential, and that should be a diet rich in colorful vegetables and fruit, primarily because they are a natural source of antioxidants. Those foods that you eat should be whole foods. They should not be processed foods, namkeens, achars, snacks, Maggi noodles. They have zero nutritional value and do zero for your immunity. The point I made on the 3 supplements were that vitamin D is essential, and this is a recommendation I would want NIDM and the Indian government to take on board, because every country has found that, the studies have found that people who are low in vitamin D had poor outcomes with COVID, those ones that were severe. Now, we know also that there is a preponderance of bad outcome in people who are of, Black, Asian, and ethnic minorities, Indian, dark-skinned people, because they inherently have low vitamin D levels. That is because, dark skin takes longer to absorb, vitamin D. And to make vitamin D, you need exposure to, exposed skin needs exposure to UVB rays. Okay, so even in Caucasian people, if they are wearing sunscreen, they will not absorb UVB and produce any vitamin D. In India, there is virtually zero fortification of dairy products or foods with vitamin D, and vitamin D levels should not be deficient as you enter this illness. Vitamin D is essential for immunity, and it is also essential for the renin-angiotensin system, which has an impact in this, and in many other chronic conditions like diabetes, hypertension, heart disease. So vitamin D, that is an excellent preventative step. If everybody makes sure that their vitamin D levels are okay, I think that that is important, and I do not think you can get that from your diet. In terms of the vitamin C and zinc, I made that specific, I skipped through those slides, but zinc has been shown to decrease intracellular concentrations of RNA viruses, and that's why, although studies are going on, we're in a pandemic. It's going to take time for double-blinded, randomized controlled clinical trials for things to come out, but things that do not cause harm but potentially cause benefit, I think that they should be taken. And my entire plan contains no such information that will cause anybody any harm and can be applied to any upper respiratory tract infection, And following these steps will decrease the duration and will minimize the severity. So, in fact, a UK physician who had treated all the severities of COVID patients, when he saw my plan, got up onto Twitter and he said, I agree with Dr. Ramanathan's plan. That is, first, avoid the infection. And second, if you are to get the infection, follow all these steps to prevent the infection from becoming severe. And that is what I said in my talk. Prevention is better than cure. In fact, prevention is the cure because there is no cure. There is no
That's
guarantee.
really great. Yeah.
There is no guarantee, not whether it's on your blood group, whether it's on, I mean, nobody is immune. Somebody asked about children. The reason I spent time talking about the ACE2 receptors, one of the reasons where children are mainly asymptomatic, it's because they are thought to have less ACE inhibitor, these ACE receptors in their upper respiratory tract. Secondly, they tend to, because their infection tends to be asymptomatic, and children, I'm talking children under the age of 10. I think as children approach over the age of 12 and adolescents, their risks and their infectivity is more like adults. But because children, get more asymptomatic infections, they're less likely to be coughing, for example, so they're less likely to be spreading. But it's very important for people to understand the basics, because only when you visualize and understand will you be motivated to do these things. And viral load is a major topic at the moment, and that's why countries such as mass masking, since the mass masking, they've had a reduction in the severity of illnesses. So they have had, and more asymptomatic cases. So that has reduced the burden on the hospital system. So that is very relevant for India.
Yeah,
and it is very important that people understand how to wear a mask properly.
That's really a very good presentation, what you have given it to us. And the second thing which you have emphasized was like oxygen improving strategies within the lungs, right?
Yeah.
So I should really thank you for taking us back into our childhood days, wherein blowing up the balloons, and indeed it is a very significant tool to keep our lungs in healthy condition.
I just want to demonstrate one thing.
Yeah.
I bought specifically.
Actually, that is what Dr. Sandhya, I was going to ask you if you can demonstrate that.
I want to demonstrate. This is in hospitals. All my exercises. And in fact, I'll tell you, my husband is a cardiothoracic surgeon. And after I made this video and he understood about the breathing, the blowing balloon, now he tells his post-op thoracic patients to imagine they're blowing a balloon. So he's learned something from this basic, and it does help, So I ordered this device to just test. Now, the most important aspect of the breathing is the exhalation, because inhalation is a reflex. Now, this, incentive spirometer, actually, you have to inhale hard to bring up these balls, which is very difficult. If I don't exhale, it's almost impossible for me to lift these balls. I'll show you. This is just inhaling. Okay, now if I try to fully exhale first. Now, if I just inhale first, I can't do it, okay? So this proves that forced exhalation is very important in terms of, optimizing our lung function. And you can do this, the balloon blowing exercise is actually excellent, because when you are sick, you need an incentive, like you've rightly suggested, exercise. Now, when people are feeling unwell, it is hard, and you're practically speaking, you're isolated, you're possibly in a small household and you can't move around. I would suggest yoga is a very good thing. The child's pose, where you sit, you're in that prone position and you focus on breathing. Gentle movement is very important to keep your body moving, because one of the mechanisms of this illness is through microclotting. And so, again, with the prone positioning,
Dr.
it's
Sandhya,
just common sense.
Dr. Sandhya, bilingual, please.
So prone positioning जो पेट के बल सोना ये कॉमन सेंस बात है, क्योंकि आपका जब डॉक्टर्स पेशेंट्स के लंग्स सुनते हैं वो पीछे से सुनते हैं, आगे से नहीं। लंग्स पूरा चेस्ट कैविटी लेते हैं, लेकिन जब आप प्रोलॉन्ग पीरियड्स के लिए बैक पे सोएंगे तो आपका कोलैप्स होने का चांसेस बहुत ज़्यादा है। और हम इस कॉन्टेक्स्ट में बोल रहे हैं कि अगर हॉस्पिटल्स में बेड्स नहीं अवेलेबल है तो आपको हर एक काम करना चाहिए घर पे, जिससे आपको बेस्ट आउटकम मिलेगा और आपको हॉस्पिटल जाने की जरूरत नहीं है। तो क्यों आप हॉस्पिटल जाने के लिए वेट करेंगे कि तभी मैं जाके वेंटिलेटर के ऊपर फिर जाके मैं पेट के बल सोऊंगा? नहीं।
I just wanted to pitch you in this over here. Like even if they reach out to hospital in late stages, अगर वो patients hospital पहुंच भी जाते हैं ऐसी condition में जहाँ पर उनको breathing difficulty है and उनके lungs इतने खराब हो चुके हैं कि they landed up into a situation called ARDS, acute respiratory distress syndrome. ऐसे situations में the maneuver which you are trying to show us, like showing sleeping over the stomach, facing downwards, is what we call the prone position. Even when patients are getting connected to ventilators, patients are being made to lie down in the same position.
Yeah.
Patients जो ventilator पे connect होके होते हैं उनको भी वैसी ही position opt की जाती है, तो उनकी breathing spaces ज़्यादा बढ़ जाएं and then they recover faster.
Exactly. और मेरे रीडिंग के मुताबिक जब ये
actually let me stress on that point. What Dr. Safiul told, it's not only related to COVID-19. जहाँ पे breathing problem हो जाता है, whatever technique you are telling, it's not only related to COVID-19. It's normal situation also. We used to do that, so we have to be very careful about it. So when breathing problem is increased, if I'm right, I'm not a medical doctor. Safi is here and Dr. Sandhya is here. So what Dr. Sandhya was telling, Dr. Safi just included into that, added into that, that is the best way to find out how we can resolve the problem of breathing.
Actually, Dr. Raka, I think with a lot of anxiety around, breathing exercises, and in my video, I've just skipped over box breathing. It's very important to practice these techniques while you're still well. जब आप बीमार होंगे तो क्यों आप फिर उस टाइम पे एक नया स्किल सीखेंगे? It is good कि अभी से आप प्रैक्टिस शुरू करें ये सारे एक्सरसाइजेस, क्योंकि इसमें आपका फायदा ही है।
Exactly, completely agreed with you, Dr. Sandhya. Exactly agreed with you. Pranayama, the Ucharana of actually, and the Gayatri mantras or something, blowing the balloon, whatever is we are having, then why not should we expand the functionality of our lungs actually in everyday life? It's a 2 minutes thing, no?
It's very important because it's also important for our...
Exactly. I can see that out of 24 hours you are having, it's hardly 2 or 3 minutes or 5 minutes maximum, not more than that. And that is going to give you a new life someday. So why don't we do that?
Dr. Raka, I have something to say for this, because considering your request, the world has dedicated one day, that is 21st of June, as International Yoga Day.
That's all right.
So God has heard to your voice.
But actually, if you look at it, yoga is all science.
Yeah, pure science.
It's pure science.
Yeah.
And ये जो आपने बोला है कि ये जो घर के नुस्खे हैं, इनके पीछे साइंस है.
Science, exactly. Without science, there is no.
और मैं एक बात और बोलूंगी कि ये जो सारे जो रिंसिंग ये 100 साल पहले भी हुए थे स्पेनिश फ्लू में.
Obviously.
ये सारे मास्क पहनना और गार्गलिंग करना 100 साल पहले हुआ था. अब क्यों हम पूछ रहे हैं कि इसमें कुछ फायदा है कि नहीं? It's not necessary to reinvent the wheel, is it?
Yeah, no, not at all. Like Santosh sir told that kadha pina is so helpful.
लेकिन आई थिंक जो सबसे ज्यादा जो इफेक्ट मेरा वीडियो और मेरे प्लान का है कि लोगों का पैनिक जो एम्पावरमेंट हुआ है लोगों का, कि अब उनको समझ आ गया है कि कैसे हम मैनेज कर सकते हैं और इसकी रीजनिंग क्या है. और इसीलिए मेरे प्रेजेंटेशन में मैंने शुरू किया है रीजनिंग पे, और ये जो वीडियो मैंने शेयर किया है कि अगर आप साइंस को समझेंगे, और कोई भी ये साइंस को समझ सकता है अगर आप उनको ठीक से समझाने की कोशिश करें।
So, but one question I would like to ask you, Dr. Sandhya and Dr. Safi, both of you are here, along with our other distinguished experts, whom I'll ask on 12th September. But two of you right now I can ask that if these things are too scientific and too relevant, and that can break the chain or somewhere that can take down the entire COVID-19 spread, whatever you talked about, and I accept that that's scientific. Why not WHO is coming with something like that? Yeah?
No, I mean WHO has said that
This question is still immature. Let me ask you completely. And even WHO is an international organization or something like that. Why not government of India? Government of India should also think about something like that. If we have some deep cultural or traditional heritage which is very helpful spreading, which is very helpful stop this spreading of COVID-19. And why not TV channels are completely showing us this should be made mandatory, in fact, on the TV channels, like they are dealing with the Sushant case and this and that, the nonsense they every day. Government should make it mandatory, 2-3 minutes talks on that. Either it's yoga or it's ucharan of om or something like that. That will be really beneficial for all of us.
Dr. Raka, Dr. Raka, can I ask one question to Dr. Sandhya also, supplement your question?
Yeah.
Dr. Sandhya, first, let me compliment you. It's a wonderful talk. The question which I raised in the beginning, you have answered most of them. Just thinking with your wisdom, like Government of India has gone for unlocking, for protecting economy. How do you draw between confidence and the overconfidence? Because the people are going into a kind of open. Many of the things which you have suggested that should be adhered to. उसको प्रोटेक्ट करने के लिए वो जरूरी है करना, लेकिन कभी लोग या तो ओवर कॉन्फिडेंस में उसको भूल जाते हैं या मासूमियत में उसको कर नहीं पाते हैं. ये दोनों के जो बीच में एक गैप है, उसको या तो ज्ञान की कमी है या ज्ञान की ज्यादा जानकारी. ये दो के बीच में हम लोग थोड़ा फंसे हुए हैं, और इसलिए 70 या 80 हजार प्रतिदिन का आंकड़ा आ रहा है हमारे कोविड पॉजिटिव होने का. तो इसमें कुछ थिन लाइन क्या है जिसको समझा जा सकता है कि लोग उस पर हैमर करें, जो चीज़ें आपने बताई उसको इम्बाइब करें, और ये पार्ट ऑफ लाइफ हो जाए कुछ दिन के लिए. एटलीस्ट ये हाउ इट शुड टू अ काइंड ऑफ अ डीएनए से ब्रश से कोविड का एक्सरसाइज करने कुछ.
Thank you, sir. Thanks. That's a relevant question. And before that, Dr. Sandhya answers it. I should tell you that we are having a long deliberation, and what we actually found that we have all the information, we have all the knowledge, we have all uh, the ways out of it, but how it's actually translated towards the normal people, the general people, that is the major concern as of now. So actually, that is what I was telling, that TV channels, why can't they show it? 2 minutes programs should be made mandatory by the government, that you have to show it, because you have to break the chain. We have to break the chain actually. So Dr. Sandhya, come forward. That whatever we talked about it.
How people have gone in New Zealand for adhering to this home remedy.
And that is what New Zealand actually did.
जैसे मैंने बताया कि न्यूजीलैंड का जो रिस्पॉन्स है वो स्ट्रेंथ इस बात का है कि उनकी साइंटिफिक कम्युनिकेशन एब्सोल्युटली क्लियर था, एंड हर एक मीडिया चैनल पे दिन में बार लोगों को बताया गया कि you must wash your hands, you must watch your distance, you must stay at home, and अब मास्क पहनना. एंड दूसरी चीज है कि जो प्राइम मिनिस्टर है उन्होंने ये बात दोहराई है कि हम एक टीम ऑफ 5 मिलियन है, कि ये एक टीम एफर्ट है। तो इंडिया को किसी ना किसी तरह समझना जरूरी है कि हर एक इंसान, अगर एक एक इंसान ये नए जो तौर तरीका है ये अपनाएंगे तो हर एक इंसान की फायदा में है। तो like the vast majority जो 80% लोगों हैं, they have to follow these rules and the pandemic will stop। क्योंकि जैसे मैंने समझाया है वो reproductive rate जो अगर एक इंसान को 2 या 3 लोगों को इन्फेक्ट कर सकता है तो that will lead to an exponential spread if you don't break the chain। But by following these rules, और जैसे मैंने दिखाया है कि masks are very effective and masks are key and hand washing is key, क्योंकि वो वायरस तभी प्रॉब्लम होता है जब वो आपका अंदर जाता है। वैसे virus particles are almost not a living organism। They only reproduce जब वो चाबी और ताला डिवाइस खोल के आपके सेल्स को एंटर करते हैं और फिर उसमें रेप्लिकेट करते हैं। And that's why that reduction in viral load is important, and masks help reduce the severity of any infection that you do contract, and that also will reduce the strain on the hospital system, and increase the number of mild cases. So I mean, that little cartoon that I made, I think the biggest thing is education actually, and that's why I made this cartoon, because I wanted to give that gift of that knowledge we've been getting in New Zealand, and I wanted to share it with India. And I would like that every, the school child, every family has access to that. I've made that cartoon in English and in Hindi. And it is something which, that take-home message is very important, that it is a behavioral vaccine, because we don't know, there's no guarantee whether we will have a vaccine। ये vaccine बनेगा का नहीं, कोई guarantee नहीं है उस बात का। तो यही हम करेंगे, हम अपने हाथ धोएंगे, हम हम अपने डिस्टेंस को वॉच करेंगे, मास्क पहनेंगे और मास्क ठीक से पहनेंगे, और अगर हम बीमार होंगे तो हम घर से नहीं निकलेंगे, हम उस इन्फेक्शन को स्प्रेड नहीं करेंगे।
एक सवाल और है डॉक्टर राणा, डॉक्टर राका, जस्ट 1 minute फॉर दिस।
यस सर।
कुछ पब्लिक पॉलिसी में क्या चेंजेस न्यूजीलैंड में आए इस चीज को एडहियर करने के लिए? लाइक जैसे आपने एक उदाहरण दे रहा हूँ कि टाइम आपने फिक्स कर दिया अनलॉक करके कि ऑफिस सबको 10 बजे पहुंचना या स्कूल 9 बजे पहुंच जाना, और रिसोर्स क्रंच कंट्रीज में लाइक इंडिया, अगर आपके एक बस आपको आती है वो एक बार में सोशल डिस्टेंसिंग को फॉलो करते हुए 10 लोगों को ले जा सकती है, तो दूसरा जो बंदा है वो स्कूल पहुंचेगा 9 बजे के बजाय 10:30 बजे पहुंचेगा। तो क्या उसमें पब्लिक पॉलिसी इस तरह की कोई लाई गई, या रिसोर्स फुल था इस कंट्री में, न्यूजीलैंड में, जो रिसोर्स से सपोर्ट और पॉलिसी सपोर्ट मिला? हिंदुस्तान के लिए जहाँ पे लार्ज पॉपुलेशन है और उसको मैनेज करने के लिए डू यू सजेस्ट एनी पब्लिक पॉलिसी शिफ्ट और सपोर्ट फॉर क्लियरिंग ऑल दिस होम बेस्ड?
Sir, before Dr. Sandhya answer on that, should I tell you that the basic thing about disaster and emergency management is true communication and to the point communication. Since the lockdown first, two, and actually the third also, we were actually receiving the true communication and to the point communication and to perfect communication. But after that, the communication has been really stopped. As a disaster and emergency management professional, I feel the communication has been stopped right. I'll request the government to come up with the perfect communication which we really need, and along with that, Dr. Sandhya, come forward.
Yeah, look, I mean, public policy is very important, and as I said, जो न्यूजीलैंड की खासियत ये है कि communication is, can you hear me?
Yes, go ahead.
Communication is absolutely clear in terms of the public policy is very clear because they have defined each into 4 different alert levels for the lockdown. So currently, क्योंकि a community outbreak हुआ है, तो हम 2 हफ्ते के लिए emergency में, like 9 p.m. at night, the Prime Minister called a level 3 lockdown. By the next day, schools बंद हुए थे, क्योंकि तब तक हम level 1 में चले गए थे, और like 2 महीने के लिए, I mean 6 weeks the kids were at school. So overnight, everyone received the alert on their mobile phone कि कल से सब कुछ बंद है, सिर्फ essential workers काम पे जाएंगे, और हम level 3 में हैं, और हर दिन हमको ये communication मिला, और it's very clear, the rules are very clear. I think India में भी ये alert system है किसी न किसी तरह. अब जब वो 2 हफ्ते की level 3 जो lockdown, और इस level 3 lockdown में government ने कहा था कि आपको masks पहनने हैं, और जब उन्होंने अभी compulsory बनाए हैं public transportation पे, और काफी schools ने भी compulsory बनाए, well not compulsory but suggested जो senior school students है उनको mask पहनना जरूरी है. So it's, and also I can see in my children's school, जैसे कि वो lunch breaks stagger करते हैं ताकि, और कोई meetings अंदर नहीं होते हैं. So it's just, it's common sense. It's using the knowledge that the main transmission now is the risky times are this, through the aerosolized spread, और जो बंद जगह होते हैं जिनमें ventilation कम होते हैं, उसमें ज़्यादा risk होता है. So, for example, here we are not allowed to have any gatherings more than 10 people. तो वो ban है इस level में. So that is public policy.
Yes.
एक और है, जैसे इंडिया में एक किया है अभी recently, even if you are driving your own car and you are single person driving as a driver also, and you are the owner of the car also. While driving as a single seated person, you have to compulsorily wear the mask. How it is going to help? If you don't, then you are fine. This is a public policy. So is it a good practice, or is a kind of not a good practice?
Driving the mask when you're driving alone.
Driving alone, yeah.
Before you, should I reflect on this question, because sir is my guru, so I have to always reflect on this question. Just a minute. Sir, have we seen that Thailand gave rescue emergency situation actually? Thailand gave rescue emergency situation. For the entire world, it was something that has given us a platform where case studies has been developed over how communication is actually important. Just a minute. Vikram, I'm over the webinar. No, not at all. No, not at all. I'm talking. I'm talking right now. Please excuse me. Right now, see, I was talking about Thailand cave rescue actually. So, it's somewhere that out of the context and out of the everything else, how communication was actually received. So the actual question is right now is, when 300 people or 600 people were going to be getting infected in this country, the entire media was off after that. But when 60,000, 70,000, 80,000 cases, government may expel me out for that. I don't have any problem for that. But where is the media actually? Where is the media actually, sir? What we are actually doing with the population? What we are actually doing with the people? And where it's not government's responsibility. Government is doing all its work. Where is media? So after that, Dr. Sandhya.
It is probably, Dr. Raka, probably each and every individual today has got sensitized. They no more feel like virus is so deadly, but the fact is the virus and the complications remains the same.
No, I'm talking about emergency communication. Emergency communication is my point here.
The question you are asking, maybe Dr. Sandhya will narrate her story of New Zealand experience. But in India, now I'm just looking at the people when I walk on the street or when you go to the office and seeing the people how they are looking at. Initially, I was finding that many people without mask. लेकिन आज मैं देखता हूँ तो मुझे लगता है कि 97-98% people are with mask. So ये this is because of the communication or the awareness of the people. Whatever way the social media, print media, electronic media, or the appeal of the Prime Minister, that's all going on. Everybody is putting their effort. The doctors are coming and giving their interviews. Like you are one of the champions which are sharing your things on the social media. Similarly, people are now getting educated and they are realizing that if we don't, probably it will affect me. So it's nobody else is going to get affected. So with this, probably this the fear has gone into the minds of the people, and that is probably where. But many in the states also we find that initially it was not there, but gradually this kind of things are picking up. But I agree with you that constantly we need to hammer it. That every day it's not COVID is not over. एंड जब अनलॉक होता है तो एक साइकोलॉजिकल ये होता है कि प्रॉब्ली गवर्नमेंट हैज रियलाइज कि अब वो खत्म हो गया इसलिए खोल दो. दिस इज द बिगेस्ट चैलेंज. जैसे खोलने को होता है एक मॉल खुलता है तो देन थाउजेंड्स ऑफ पीपल आर देयर ऑन इन द मॉल. तो उस समय रियलाइजेशन नहीं होता है कि प्रॉब्ली अभी कोविड खत्म नहीं हुआ, कोविड इज स्टिल देयर. तो यहाँ पे थोड़ा सा एक लाने की जरूरत है. ऐसे नॉर्मल लाइफ में पीपल हैव ग्रेजुअली ब्रॉट इनटू दिस, but before opening also we need to do a lot of public awareness or emergency communication, what Dr. Raka is saying. Like metro हमारे यहाँ खुल रहा है, public transport खुल रहा है, तो उसमें बताने के पहले अभी मेट्रो का मैं कई एड्स देख रहा हूँ कि आपको क्या क्या चीज़ें करनी है, हाउ द सोशल डिस्टेंसेस कुड बी मेंटेन. लेकिन इसको ना जो एक्सेस है टेलीविजन का वही देख सकता है. बहुत सारे लोग ऐसे हैं हमारे यहाँ जो एक्सेस ऑफ मीडिया नहीं है, तो वो भी एक इशू है हमारे देश में. इतना बड़ा पॉपुलेशन है तो एक दूसरे से सीख के या कम्युनिटी के जो कम्युनिटी लीडर्स हैं या जो कम्युनिटी या इम्पोर्टेंट लोग हैं उनकी बात लोग सुनते हैं, उनका भी एक बड़ा इंपॉर्टेंट रोल हो जाता है इमरजेंसी कम्युनिकेशन में. नॉट ओनली दैट प्रिंट एंड इलेक्ट्रॉनिक मीडिया ऑल्सो, बट पीपल आर सो. आई वॉज लिसनिंग, आई विल जस्ट एक आज एक स्टडी आई है और उसमें मैं देख रहा था कि व्हाट आवर member of parliament and legislatures are doing during the COVID time and the assembly and parliament not in the session. So एक बड़ा important ये आता है कि how they can use their time for informing people about with they are into public life. So their responsibilities also there. So many of us we found that they are spending time in reading newspaper or reading books and all, but also they are spending time for social work. So that could be one of the incentive for them to educate and inform people with their volunteers. Political parties can come together. They have large number of volunteers down the line of political parties. They can educate and inform people. Because first is to together save the lives of the people. That is much more important. Who wins election is the second thing. But the first thing is this, to helping together, like all political parties come together, their volunteers come together and take this communication to the last mile. That is much more important. So that's what I was at. Thank you so much for.
Perfectly all right, sir. Perfectly all right. And I appreciate all your valuable feedbacks. And it was actually wonderful. Three questions, sir, from you and all the experts present here. Is this the real emergency communication, what we are receiving? 300, 400? Sir, let me complete my questions and after that everyone will be open to answer it. Sir is my guru, so he will also be able to explain it and along with all you experts. I mean to say, see, our Prime Minister is actually too much involved into a lot of things, but the emergency communication for the country is equally he is responsible for it. So, sir, if you are listening us, if any time our voice is reaching to you, we are really very, very eager to listen you at the time of when the emergency is actually on our head, and we would like to listen you on this literally emergency communication we need from. It's not like that all these private channels, whatever they are showing, this is not relevant to us, sir. This is not. We need to break the chain. We need to break the chain and we need to defeat this COVID-19. And for this, we need actually support of your private media. I tell you, I beg you, I request you, sir, for this, I need support of this private media. Thank you. But this is the only thing I want to ask. Sir, your voice is not, we can't listen you, sir. Again.
I was telling, Dr. Sandhya explained that how in New Zealand emergency communication went off. And that explained that she was narrating about this use of SMS. And that was very effective and informing people. So like even if in India, like any phone calls you make and before that coming that about the COVID-19 messages, that how it will affect you and so what kind of this precautions you should take. So this was a very good initiative by the government in terms of informing people because this was a very new kind of a virus where the people are facing. That time it became joke also that the government was handling. Once you get this information and 10 times you are getting the same information, you are thinking that I'm already educated. Is what like the same way when you don't listen when you board the plane and the announcement goes on that please fasten your seat belts and put that. So you become that I am a frequent flyer and so it will not affect me and you become so same kind of a thing. Our public behavior was also that, and we started making cartoons and other thing also on the government initiatives that many of the people that every time we listen and we listen to COVID and what we wanted to talk that we get will just be forgot. So this happens because we need to hammer if we have to go in the public domain. Many attempts have been taken, and Honorable Prime Minister is also in every speech is making public appeal that how people should behave and their responsibility and as they act like a responsible citizen. Similarly, medical people also that I see.
But sir, appeal of Prime Minister is not very well taken by the private media channels. That is my question.
That is media ethics is also there in place. It's not that the media ethics is not there. So many media have shown, but maybe we have realized in 4 months of time that everybody has got this information, everybody has got educated, everybody is informed. So now people have become a prudent citizen from ignorant to the prudent due to COVID. But things are not like that.
Yeah.
Complacency comes in the information giving also. So that kind of a complacency has to be avoided. Like all the hospitals, they were coming up. They say all webinars are coming on COVID-19 and our child-centric center DRR also is giving first information on the COVID-19 itself. लेकिन ऐसा लगता है कि सुनने वाले लगता है कि दे आर ऑल उनको सब पता हो गया है और उसके बाद लगता है कि अब इसको छोड़े और आगे बढ़ जाए. तो इस तरह की कॉम्प्लेसेंसी होती रहती है. मुझे लगता है कि जैसे कि टीवी पे या टीकाकरण पे पहले से जैसे सूचना सरकार देती थी, आज भी सरकार सूचना देती है वर्षों के बाद भी. तो इसका एक रोल है और आई एम नॉट डिनाइंग दैट हाउ प्राइवेट चैनल्स हैव बिकम मच मोर सीरियस and be part of the warrior of the amongst all the government initiatives and taking part. So that's what we wanted to hear from some Dr. Sandhya, how the private channels and because they are in New Zealand, other than the government, private players are in the large number. So how the private
yes,
players,
Dr. Sandhya.
How do you say, and then we'll go to also Dr. Khaja. He can also inform us that how hospital fraternity are also working in the service sector, public health and
yes,
Dr. Sandhya.
Yes.
Yeah.
Yes, sir. Yes, sir. Dr. Sandhya, since all the news channels, all the private news channels in New Zealand also and Australia also are almost private. It's not government controlled. But how they have actually delivered their social responsibility at this time of COVID-19 that Indian news channels also need to learn because our Prime Minister, our government is constantly telling what to do. But these channels are really pathetic. I should say they are really pathetic. They are not. keeping a heed on the messages of Prime Minister, the messages of government. They are dealing with something else.
I think
And we are receiving 80,000 cases, the world's widest cases as on a single day. That is a matter of concern for us.
I think that the point is that in a pandemic, there is only one truth, and that is science, not politics. And unless and until a country follows science, you will not get control of the virus, because you can see America. One of the benefits of New Zealand is it's it's a federal system. It's not multiple countries operating within one country, because even in Australia, you've seen that Victoria, which has a similar population to the whole population of New Zealand, because New Zealand's 5 million, Victoria is 6 million. Even in a small place, you can have a pandemic that gets out of control. So it's not necessarily on the population numbers, And initially in the pandemic, for example, some states in India, because I think the same problem is in India. I mean, it's very difficult to get control if you're trying to control many countries within one country, because every state is doing something differently. And I think Kerala had an excellent, because the science and the reasoning and the public health management of a pandemic doesn't change. The effectiveness of controlling the pandemic comes down to the ability of the leadership to communicate what is required, and then to basically make that happen. So, for example, me as in primary health.
So actually, leadership is not lacking. I'm talking specifically about Indian media.
But you can't. But the media has to be directed by the leader. So every media channel turns off at 1 p.m. when the Prime Minister and the Director General of Health get on and give their update. And it's every, radio station turns off and you hear that. Just like in your, civil disaster, Akashvani ko खुला रहना चाहिए, उसको बंद रखना नहीं चाहिए, नहीं तो आपको पता नहीं चलेगा कि सुनामी आ रहा है कि नहीं आ रहा है, So communication is key. I mean, we getting almost a daily, हम primary health में हैं, तो general practice is at the front line. तो हर एक दिन हमें text message के जरिए हमें मिलता है कि आज का ये जो अब testing routine और schedule ये है, like ये लोग test होंगे या, so we have to be constantly on it. But basically, we have good leadership and we are being advised. So in the Indian context, because of the volume of the population, the key message that has to come across is the key message I made as the take home from that short 4-minute video, कि हर एक इंसान को अपने हाथ धोने हैं, अपने distance को watch करना है और अपना mask पहनना है.
Whatever you told, how it has to be reached to the each and
every social media, the leadership has to promote this message.
The social media is our individual
media, social media, because our leadership has put it on every social media, whether it's Instagram, whether it's on Facebook, whether it's on Twitter. The Prime Minister and the messages are there. Safe New Zealand is there. The messages are coming constantly.
What the leading news channels are here?
Well, I mean, most people here, we have mainly, the 3 free-to-air channels. Most people have cable, but the free-to-air channels, the news things come. But it's, again, it's the awareness is everywhere. It's on the radio, it's on social media, it's on the TV. You get texts on your telephone. The national emergency text, there is no room for argument.
So actually, you want to see that New Zealand news channels are as irresponsible as Indian media actually?
Well, I would say that for some reason, bad news sells. And I think all media focuses on the problem and not the solution. Just last week, I was on mainstream.
Actually, that is what you can suggest for Indian media actually.
Yeah, well, interestingly, last week I was on mainstream New Zealand news channel in the morning and in the evening, covering my story of what I've been doing around the world. And you know, I was only given 5 minutes in the morning session and 3 or 4 minutes in the evening session to cover. And so many people said, you know, a gentleman from New Zealand said, you are the one shining light in all the doom and gloom of this pandemic, because you showed us that the only answer is self-management. And since I have made my video, so many people on whatever social media platform said your video should be translated in every Indian language, in every language, and should be played on every channel. Now, nobody has come and helped me do that. I am doing it on my own because I know it's going to make a difference. But if somebody helped me, I have done this all alone. I have got it in 8 languages so far, and I will keep on working because I know it is helping people. But you know, that is the thing. You know, it's empowerment. It's that हर एक इंसान को अपनी जिम्मेदारी खुद उठाना है. आप अपना जिम्मेदारी गवर्नमेंट पे नहीं छोड़ सकते.
That's right. That's right, Dr. Sandhya. Thanks a lot, Dr. Safi, for your comments over it. Dr. Safi.
Dr. Raka, you are promoting me to comment on media. It's really a very delicate issue in India.
That is why we are here. Actually, boss, that's why we are here.
All right. So basically what I recommend is, like, as what Dr. Sandhya has told, self-accountability is the key. Each and every individual has to feel themselves to be responsible. Only then we can try to limit down the chain. And on media, if anyone is coming and giving any kind of interviews, like, I would rather recommend the politicians, instead of promoting their own parties, try saving the lives. Give the live interviews. Let not the media people deliver their own words, because every channel takes up the junk of stuff and then they try to manipulate it and then they deliver it. So everybody has their own version.
But the mean to say that whatever is actually should be delivered to Indian masses amongst 60,000, 70,000, 80,000 cases every day, that is actually not being delivered. And that is our question, what we are raising here on this platform.
That's what. So the first-hand information we need to get, like, there has to be a channel wherein we can get the first-hand information. Maybe
why only a single channel? Why all the private channels can't do it?
That's the regulatory.
Dr. Raka, Dr. Khaja, I would just like to say, if India's policy that is being pushed in COVID-19 is this Atmanirbhar Bharat,
yes,
this is the most important point of Atmanirbhar Bharat.
This is our Prime Minister's dream. This is our Prime Minister's dream.
Yeah, but
I don't these private channels are realizing that.
But the most important step in the context of the COVID-19 pandemic is you must make every individual self-reliant if they are faced with COVID.
Yes.
उनको समझना जरूरी है कि इसको कैसे avoid कर सकते हैं, और उनको समझना जरूरी है कि, you know, like, this is a collective effort.
That is where I can think that our Prime Minister is saying something else, and the entire private system of this country is doing something else. So I'm very, very, very reluctant with this.
But that's why you should. That's why that's.
Our Prime Minister has a certain vision, and he is seeing the things, and he's perfectly telling the things where we have to be. आत्मनिर्भर का मजाक बनाना शुरू कर देते हैं लोग यार, but they don't understand what is actually meaning by आत्मनिर्भर. And the private media is actually having a very, very, very important role to play with that.
Dr. Raka, I'll just say diversion. In the media, that Dr. Sandhya is there. I will just ask one question, because New Zealand is one of them. How do you see that women leadership in the management of the COVID-19?
I think female leadership is excellent because women by nature are empathetic, and they have very quickly understood that the current economic crisis is the health crisis. So women leadership and the economic crisis will not be solved until the health crisis is solved. So, so all of those countries where women have been in lead, they have allowed medical experts to determine their public policy. And doctors have been, and healthcare workers have been busy on all fronts. Not only are they treating patients, not only are they decoding the tsunami of information, they are advocating hard on social media platforms in every way, shape possible to inform government bodies to change public policy in order to save lives and mitigate the effects of the pandemic, because by nature, that is our duty. It is to, protect others, but it's also to protect ourselves. And it's the healthcare workers that are suffering the rawest end of the deal. I mean, why is this such an area of passion for me? Because this is self-preservation. I could be any one of those doctors on the front line, losing my life, losing the life of my husband, or my older sister who's an anaesthetist, or my closest friends. So why should I do that? I didn't sign up to be a hero to throw my life away. I didn't want somebody to to knock a burden for me. Give me adequate PPE. Give me adequate PPE because a dead doctor is no good. And it takes 12 to 15 years to train a specialist. You cannot replace that loss.
Perfectly all right, Dr. Sandhya. You are not only the warrior, but the thousands and millions of doctors are the warriors, and they are saving the entire humanity, the entire continents beyond the boundaries of countries and the states. And we had suffering. Yeah, actually, this is the time. This is the time. Actually, we have understood the meaning of being a doctor. I'm having a lot of platforms on my doctors on my platform today, and every time I'm getting a message, some patient is there and I have to take care of it. So please excuse me. And this is how life goes on. Actually, that is how human dignity is maintained. That is how human life is maintained, and that is why you doctors are the gods. The gods. Along with that, let me take a little bit feedback again. Khaja, I'm not coming to you. The first of all, Maurya, I don't know. He is listening to us right now because I have received a message from him. Dr. Maurya, if you are back, Dr. Maurya, if you are back, he is into some surgery, some emergency right now. So let's go back to another one. Dr.
Yeah.
Maurya, okay, you are here. So, Dr. Maurya, please, your words again.
Sorry, yeah, you can.
Actually, we discussed a lot, but he was busy with your all the things he was saving, and you are a warrior. You are just a god right now, and I appreciate that. My heartfelt thanks to you. Whatever services you are giving to humanity, and he was all the way out with some emergency things. But last words from you, because we are going to end the session.
Sorry, can you please repeat it? I'm just.
Actually, we are going to end the session today, and if you heard us, if you listened us, then a few last words. Otherwise, we know that he was into some sort of emergency, and he was doing your duty as a doctor. So your last words, last few words.
Yeah, I just want to say, I mean, regarding, this COVID, I think we have to understand that this is a pandemic which nobody has seen in their lifetime, not even, our fathers or, anybody. So this is something, new for everybody. And last pandemic, if I hear of such magnitude, happened in 1918 of influenza, the flu pandemic. So yes, people have, how many people don't know what to do, what is right and what is wrong. So it's becomes so the duty of those who are gradually becoming expert, or gradually knowing the things and knowing more about this coronavirus, that they can they can allay the fears of the people, and can disperse the information in a more informative way, as we have seen that what Dr. Ramanathan is doing it at the moment, in a much beautiful way. And I think everybody, is whether the role of a government, whether the role of private agencies or media, everybody has to play their role in a much better way, so that we can take care of this pandemic in a much better way, and we can decrease the mortality as what we are seeing all over the world. So that would be the best thing, because it's not going sooner. So we have to be much more take extra steps, and so that we are able to decrease the morbidity and as well as the mortality related to this pandemic. That's what I would like to say.
Thank you, Dr. Maurya. And we are having a lot of questions, almost hundreds of questions for 12th September, and I'll send you in advance to you, and we'll be looking forward for your very genuine answers for that. Next is Dr. Milap Mukherjee. Milap Mukherjee, if you are listening me, just a reflection on Indian media and what you listened about New Zealand media, how they have been quite capable of handling or mishandling the entire situation. Just a few words, 2 minutes. Milap.
Hey, thanks, Dr. Raka, to bring me online again. What I would like to say here is I think, there is adequate measures at all levels taken. The core fact is, the education system, the outreach of education, the link that is broken, those who aren't able to come into approach or even know about it can become a big amount of risk is what I mean. Yeah, well, about media, I would really not like to comment about the media, but it is true that they should have the responsibility of trying to drive the awareness to an extent that people can take care of themselves, and it's about doing the basics and adapting to the new habits, and yeah, that's what I would like to say, adapting to the new habits, the new normal, and trying to work your own way out in terms of not just living, working, being with people, and keeping everyone energetic.
Thank you, Milap. Thanks a lot. The next, I'm coming to Dr. Amit Murari. If you are listening us, just a quick reflection on the entire session, specifically about communication strategies, what we have taken, what we have adopted for just. Oh, I had a lot of calls on my mobile. I'm sorry for that. So, Dr. Amit Murari, the communication strategies into the disaster management and how we have been capable of handling it vis-a-vis COVID-19. Dr. Amit Murari.
Sorry, I'm not getting your voice.
Listen again. Since you are a doctor or you are a medical practitioner in National Disaster Response Force and you have been handling a lot of emergency situations, so my simple question with you, how is the emergency communication is important and how much we have been capable of doing it vis-a-vis COVID-19?
Which communication?
COVID-19, emergency communication with COVID-19.
Emergency communication with COVID-19 scenario.
Yeah. Your quick reflections on that.
I'm not getting your voice clearly. I'm not getting your voice clearly, Raka sahab.
Can you listen me now? Can you listen me perfectly?
Yes. Now, okay.
Okay, let me ask you. Emergency communication is the essence of disaster and emergency management.
No. Your voice still breaking. Voice is still breaking from my side.
Yeah.
There is some network issue, I think.
Okay, listen again. Listen again if you can listen. Otherwise, I'll go back to the another panelist. If you want, if you can listen me this time, go ahead. Otherwise, we'll transfer to the other panelist. Disaster and emergency communication is essence in any situation, and how India has been capable of doing that vis-a-vis COVID-19.
Voice is not clear.
Now you can listen me.
Voice is not clear. Your voice is not clear.
Oh, I don't know. My voice is not clear to you.
No, there is some network issue from my side.
Okay, I'll come back to you. I'll come back to you. So Sumit ji, how many questions we are having right now? Sumit Gupta.
Can you hear me, sir?
We are having, yeah. Go ahead.
Sir, so many questions are there. I think for the 12th of the September, there is a lots of question we are compiling, and very intelligent question. I think very starting to the
We are already 1 hour
disease,
late
earlier
because we
prevention.
are
Yes.
not going to take any question today, but we will be taking all the questions on 12.
Yes, of course.
So at the last, Santosh sir, if you are listening us, come back and give us a departing remark for today webinar. I think Santosh sir is right now here. Namrata, you are here.
Yes, I'm here.
Sir, Namrata is now on the line. Namrata, in 2 minutes, just reflect your thoughts.
I've been here throughout the session, and in the end, I would just like to thank Dr. Sandhya. And I know we always thank our speakers, but this is like truly something that's coming from my heart. And I have never experienced such close communication with a doctor, and never heard, like, even in the comment section, I mentioned I didn't want Dr. Sandhya to stop talking because it's like the way she describes everything in a layman's language. It's just beautiful. So thank you for such a knowledgeable session, and we will be back on 12 with a lot more participants, and would love to hear, because even I have put some doubts
Thank you,
in mind.
Namrata. Thank you. Thanks a lot. Santosh sir is waiting and we are running out of time.
Yes, sir. Yes.
Santosh sir, your time now.
Dr. Raka,
yes,
I
yes, sir.
just extend my heartfelt thanks to Dr. Sandhya because I've taken a lot of questions and she was wonderful and been able to answer most of the queries. We will request her to accept the invitation of NIDM again when we are going for this campaign as a career, and we will join you in taking this agenda forward. Thank you very much for giving me this opportunity.
Thank you very much, sir. And along with that, let me finally conclude this session today. It was a wonderful talk, and I must extend my gratitude and grateful thanks to Dr. Sandhya Ramanathan, who has given us our valuable time, and she has gone with the length without taking a break. And the first time I saw someone that is speaking for 1.5 hours or 1 hour 50 minutes or something like that, you have been wonderful, Dr. Sandhya. Hearts of Dr. Safiul Khaja, always our greatest strength, greatest strength. Thank you very much to you. And Dr. Maurya was here also. He was trying to he was trying to give give his inputs in between, but along with that, there was a lot of hospital concerns along with him. And nonetheless, thanks to Milap, Namrata, Santosh sir, Sumit Gupta, and Singhal also. Singhal was also here. Dr. Vikas Singhal was also here, but he could not actually join us because he was also having a lot of medical concerns. And they all are actually dealing with the COVID-19 patients at the moment. and so we can appreciate their time actually. At the final point, I would like to say that this was a wonderful, wonderful talk. How to manage COVID-19 within with the home management technique, घरेलू उपचार जो कहते हैं. And there we have received almost over 500 or 600 questions. And I'll request Sumit ji to compile all the questions so that based on these questions only, we will be delivering our next webinar that is on 12th September. So all of you experts, all of you COVID warriors, all of you COVID-19 doctors, you will be receiving the questions well in advance, and we will be we will be waiting to get the answer from you. And I'll also request Dr. Sandhya to be present on September 12th. And last, not last but the least, uh, very, very thanks to Santosh Kumar, Major General Vikas Kumar and National Institute of Disaster Management, who are the brain behind it. I'm just the implementer out of the what they are conceiving. I'm just the postman who is delivering it actually. So thank you very much, and let's end this talk today. Let's meet again on September. If anyone, if you want to say something, must come forward.
Having given importance to their language, as I said in the beginning, our problem is we are not monochromatic or monocultural.
Actually, we are not able to listen. Can you raise your voice?
Germany, Italy, Spain, all these countries have now started quickly because the IT revolution has made this unavoidable. Just imagine there is a lot of work is going on in
Actually, listen us. We are not able to completely listen you. If I'm not able to listen you, just let me tell you. Your voice is too low. We can't listen you.
I'm not saying that regional languages should be neglected. My basic contention is this policy. English has been made
Sir, even in the comment section, somebody mentioned that there's probably some misconnection between the two webinars, and we are hearing voices from the other webinars in such a long time. So I think that's what is happening.
That is something we can't. We actually.
Yeah, exactly.
If I request you, just put your question in the chat box, and we are collecting it right now. We have almost collected 300, 400 questions at the moment. And if you put your question in the chat box, that will be better for us. So let me allow all of you participants to end this program here because we are almost at an hour limit. 2 was our end time, and it's almost going to be 3. So all the best to all of you. We'll be meeting again on September 12th. Most welcome. Thank you very much.